coming through.
At the Bondi clinic, little 8-week-old kitten Coco has arrived in the arms of his anxious owner, Robert.
Okay, so just explain what's happened.
The dog walker found her under our dining room table.
Yep.
It's got a V-leg.
Yep.
She was lying upside down with her head stuck between the legs of them.
Wow, okay.
And we don't know for how long.
Yep.
We left home at about 9, so
Yep.
this was about 12:30, so...
And so it could have been anywhere up to 3 hours.
Yeah. My real fear is that she dies, and I have to explain that to two kids that have gotten to really like her a lot. Well, don't really know what we'll do then.
And when she was actually freed, what did she do?
According to the dog walker, she collapsed. She
Yep.
went completely limp. And then when she put her down, she just couldn't walk.
At first glance, Coco isn't in a good way. She's been wedged in that table leg for anywhere up to 3 hours. And my worry is that in the effort to try to free herself, she may have actually done more damage. When you have 2 bars pushing in the side of your neck, you can get a situation where either you have all the blood going to your brain but not being able to get back from it, or you have not enough blood going there in the first place.
Yeah.
Did she have fairly straight eyes before?
I don't know.
The thing is, this left eye is deviated off to the left, whereas the right one is in a normal position.
Yeah.
Look, structurally, the rest of her feels okay. To be honest, if you ignore what's happened to Coco today and ignore her age and just look at the symptoms she's showing, what we're looking at here are the classic signs of a stroke. I can feel a little heart racing quite quickly there at the moment. So what we need to do is just try to reverse this sort of semi-comatose state we've got at the moment. So my feeling is that her brain's gone through some sort of shock there, which is now affecting the rest of her body. What I'd like to do is do 2 things. First of all, get her on some oxygen just to help stabilise her, but also give her something for the shock, something that's going to take away any swelling that she might have on her brain. My hope at the moment is that it's just exhaustion from her trying to free herself from that table leg. But the big concern is obviously she may have a serious brain injury.
He's got some just lacerations and he's just really traumatised.
Okay. What's his name?
Juice.
All right.
At the Bondi Referral Hospital SASH, 11-month-old Juice has been rushed in by his distraught owners after a shocking screwdriver attack by callous burglars.
I just don't understand how something like this could happen to him. Like, he didn't deserve this. He probably just went up to them and jumped up and started licking them. He's so innocent.
Okay, so we're just going to lift him onto the table, okay?
Dr. Laura Musgrove is the first emergency vet on the scene.
2, 3. Good boy. Good. As I get up close, he's got lacerations all over his face, and it looks like he's been stabbed in the eye. There's blood everywhere, there's blood on the inside of his collar. He looks awful, the owners are really upset, and honestly, I can't really see a lot to do with the eye because he's squinting, but it doesn't look good at a first glance. Come on, darling. It's all right. Poor little man.
Distressed owners Meg and Todd are horrified at the sickening attack on their beloved Staffie.
We think they've personally thrown Juice. Juice has followed them into their house and he's startled them when they've thrown Juice into the wall. There's a massive hole in the wall with blood all through it still.
Sweetie pie.
It seems like they've hit his head against a door frame. There's blood all over the door frame. So it's just... can't even comprehend.
Oh, it's sore, isn't it, hey? It's all right, sweetie. This left eye looks like totally perforated, and he's got some other wounds as well on his face. Oh, I know. We'll need to get a bit more pain relief on board and do a better look there.
I'm just going to take this off. This is quite tight around there, isn't it?
Well done. Here we go. Oh, I know. Good boy. I'm just going to try and have a better look at the eye using the ophthalmoscope because I really just want to see if things are intact or what the extent of the damage is. But it's a real mess in there. Oh, sweetie pie. It's sore, isn't it, hey? His eye looks terrible. Poor little man. Just makes me so angry that someone could have done this to him. Can we hold your eye open a bit? Good lad. It's really difficult to see a lot with Juice's eye at the minute. There's a lot of bleeding. We can't even see his pupil. I think his cornea is possibly ruptured, and I'm not even sure he can see out of that eye at this stage, so it's looking pretty bad.
sleeper here.
At the Bondi clinic, Chris is giving little Coco oxygen to try to alleviate the effects of shock.
Coco's body is essentially playing tricks on her. It's panicking, which means she's taking shallow breaths, and shallow breaths just aren't effective enough.
The kitten has been found unresponsive after being found wedged in a table leg.
She's taking deeper breaths there, which is good. The issue we have with shock is that it's essentially where the body starts to shut down. It panics and doesn't have a normal distribution of the blood supply and also the oxygen in that blood supply. The positive sign at the moment is that Coco's taking deeper breaths. The most effective way of making sure the blood goes to the organs where it needs to go is by giving her a really strong dose of anti-inflammatories. So I'm just going to go into the muscle here. There we go. The hope is that between the oxygen and the very strong anti-inflammatory, we'll find a way to actually decrease the pressure on her brain and actually allow her to fight off the shock she's currently experiencing. So she's breathing a bit more easily there. I might just set up the X-ray and get a quick shot.
In struggling to free herself, Coco could have injured her jugular, arteries, or worse still, her spinal cord. An X-ray will allow Chris to check whether the bone structure is still intact.
X-ray!
Okay, so I've just isolated that area around the neck that was actually stuck between those table legs. So what I'm looking for are any signs of any fractures or any areas of extra swelling that just shouldn't be there. All the critical things for survival are all in this one zone and they've all been crushed. So it gives you a great indication about why you're entitled to be so concerned. All our vertebrae are in place and we've got no little bony pieces coming off to the side there, so we've got no fractures. The only damage we must have in this neck region is soft tissue damage. My feeling is when those bars pressed in, it meant the blood flow was still able to get to the brain, but it just wasn't able to drain away through the veins. That meant essentially the blood pressure within the brain got really high. If that pressure inside of her skull has become too much, then there's always the risk she could have had a bleed, essentially had an aneurysm inside of her brain, and that could explain the signs we're seeing in her right now.
All right, darling. This next bit's not going to be too nice, though, is it?
At SASH, emergency vet Dr. Laura Musgrove is treating 11-month-old Juice after he was brutally stabbed in the eye during a burglary.
Good boy. Can we hold your eye open a bit? Good lad. Looking at Juice's eye, it's actually really difficult to know how much damage there is. There's so much swelling and he's holding it close because of the pain. I want to make him comfortable, flush out any debris and blood clots in there and assess his other wounds.
Should we just give a little clean of your face?
Good boy.
Yeah, looks much better now, doesn't it?
I think we might leave it at that for that eye now. It's not the nicest thing, is it, buddy? All right, a bit more.
With Juice stabilised and given pain relief, Laura now has the difficult task of talking to heartbroken owners Meg and Todd.
Hello. How are you doing?
Yeah, good.
Okay, I'm Laura. I know we briefly met a little while ago and things were a little bit stressful. Okay, so first of all, I just want you to know he's okay. All right, so we've got him stabilised. I mean, I think he's very sore and probably in a little bit of shock from what's happened, okay? You know, if it is a screwdriver that's gone in, at this stage we don't know how much damage it's done. We need to let things settle a little bit, but I guess the worst case thing is that he could end up losing that eye. Okay, so what we'll do as a next step is we'll get our ophthalmologist to come and have a look at it and just see, you know, whether we can save it. Okay?
Thank you.
It's all right. I'm not sure Meg and Todd have been able to grasp exactly what I'm saying. I think they're still in shock from everything that's happened, and I'm not sure they understand that Juice could potentially lose his sight, and worst case scenario, he could lose that eye. Hey, Juice. Juice, look who's here. There you go.
It's okay, buddy.
I hate seeing him, like, just
He's
so helpless.
Ever cried.
Yeah, he's never made that noise before, so I just hope he settles a little bit.
I feel really sorry for Meg and Todd. They've had a day from hell. Not only have they had their house robbed, they've now got to leave their beautiful boy here in hospital. I just really hope we can save that eye. Okay, guys, all good?
All right, okay.
Yeah.
Thank you so much.
Honestly, our pleasure. Come on. Oh.
All right, Coco. How you feeling there? It was the play session that went wrong, wasn't it?
At the Bondi clinic, Chris is closely monitoring little Coco, the kitten found wedged in a table leg.
The biggest concern I've got is that what Coco is essentially facing at the moment is a strangulation injury. By being stuck between those bars, pushing on the sides of her neck, the artery flow would have been strong enough to force blood up into her brain, but the vein, being a lower blood pressure, would have meant that it never drained out. So she could actually have had a massive pressure build up inside of her brain. If that has occurred, then there's always a risk of something like a stroke occurring, a bleed inside the brain.
That's it.
Coco has been given oxygen and anti-inflammatories.
The next few hours are quite critical to see exactly how she recovers, because if it's simply been a matter of her being stuck for a little while, being a bit stressed and now becoming a bit exhausted as a result of that, then she'll begin to improve fairly quickly.
Coco's owner, Robert, has been anxiously waiting for news.
So she's just here, she's just on oxygen there. Yeah, she's doing okay.
The little kitten also has two other special visitors, Robert's daughter Kira and friend Ariella.
How you going? So I'm Chris.
Hi.
Nice to meet you guys. So you've obviously heard what's happened. So she's just resting here at the moment. You can see she's not too aware of what's going on around her at the moment. But what we're trying to work out is whether that's just because she's very tired, because she's had a very big day, or whether she may have actually done herself some damage. We're doing the best we can. I know she's doing the best she can as well. I promise you I'm not going to rest until we see some sort of sign of improvement from her. After seeing Coco's family this afternoon, clearly there is a lot of love for her out there, and hopefully that does count for something. My wish is that over the next 12 hours or so, with some extra rest and with some more time for those drugs to take effect, she really does turn a corner. But at the moment, there's no way of knowing if that's going to happen. There's a lot of people at home that want you home as soon as possible.
Oh, good boy, you sit there and show us good luck. Let's have a look today. It's just awful, isn't it?
At SASH, emergency vet Dr. Laura Musgrove has called in ophthalmologist Dr. Alison Groff to look at Juice's horrific eye injury.
Can we have a little look? Good boy. Is that a bit better? He's been stabbed in his eye with a screwdriver and other places on his face, but this eye really worries me because I'm not really sure whether he can see anything out of there, so wow. I'm hoping we can find out a little bit more and potentially save the eye, but I mean, have you ever seen anything like that before?
I've never seen anything like this before.
It's awful, isn't it, darling?
Horrible.
If it's a pretty major injury for Juice, the eye has been ruptured, some of the tissue from inside of the eye is coming out, and the eye does not respond to light at all. When I move my hand towards his face, he doesn't show any normal reflexes, which is why I'm worried that there is injury deeper within the eye.
So it's not looking very good. He doesn't seem to have any vision in that eye. All right, well, we'll ultrasound to see whether there's any damage further within, and I'll let you know how we go.
Okay, mister. Good luck. Good boy. Unfortunately, I think Alison has the same fears as me, that there's a lot of swelling there. At the minute, we don't think he can see out of that eye, and so I think she's probably as worried as I am that he might end up losing that eye.
It's a very collapsed eye, so it's very difficult to see what I'm doing.
Poor guy. So this here is the retina. The retina should be lying right against the back of the globe, but it's become separated. And when the retina is not in its normal position, it doesn't work properly. And if the retina doesn't work, then there's not going to be any vision. It's really, really sad. Yeah, it doesn't look good. So the ultrasound confirmed the injury was really severe, and the best thing for Juice is going to be to remove the eye.
Ah, poor puppy.
You're a funny little thing, aren't you? We might just use this chance while those eyes are open to have a look in there, just see what sort of response we're getting from the pupils.
At the Bondi Clinic, Chris is looking for any sign of improvement, however small, in little Coco.
Okay, yeah, so we're getting a response there. If there's one thing that's worrying me, it's the fact that Coco still doesn't have much awareness of what's around her, and that's a really big hallmark of a brain injury. If there is one positive, it's the fact that her pupils are actually responding to the light. But it's been 6 hours since the accident and she's still not really showing too many signs of awareness and is still in that semi-comatose state. I would have hoped by now that we'd be starting to turn a corner and be starting to see some more positive signs. But you have to remember that Coco's young and today has been a day like no other.
All right. You're all right. That's it.
Chris is now concerned about the 8-week-old's hydration levels.
I mean, it seems strange that just a few hours ago we were worried about almost too much blood pressure, and now we're trying to replace that fluid in her system to make sure she doesn't become dehydrated. So it's just the challenge of looking after small kittens. Things change very quickly with them. All right, so she's now going to stay well hydrated. She's got those drugs on board from before. I think we're probably okay to actually give her a cage to rest in now.
Yeah. Okay.
Coco will spend the night under observation at the clinic.
Okay, Coco. Welcome to your little hotel. So what we need to do is something you're very good at. Yeah, which is sleeping. My hope is clearly that today's just been a massive day for her, and the reason she's so unresponsive is because she's simply exhausted. I'm not sure if I'm being too optimistic in thinking that, but hopefully with, say, 6, 12 hours, we'll start to see some more positive signs from her. See you later. Won't be too far away.
Ah, poor puppy.
At Sash, 11-month-old Juice is about to undergo surgery to remove his badly injured eye.
Poor guy.
The American Staffie was brutally attacked by burglars with a screwdriver, which has caused irreversible damage.
Certainly no chance of saving this eye. The decision was made quite easy for us by the fact that he wasn't going to have a chance to see. So the first thing we do is remove all of the attachments and then manage any bleeding. It's generally a surgery that has a very low risk of complications, but all of the tissue is very inflamed and very swollen. And this is going to take a while because it actually is a bit more difficult than usual.
With the surgery underway, it's a harrowing wait for Juice's distressed young owners, Todd and Meg.
I just feel so bad that he's gonna lose his eye, only being 11 months old and the rest of his life not having an eye is just so sad. But he's pretty strong and happy, so.
Happy, playful little dog. He'll still be strong anyway.
Yeah, I'm sure he'll be okay, but yeah, I guess we're just in shock.
There's a lot of bruising in here.
Alison is also shocked to discover Juice's wound has penetrated far deeper than first thought.
The injury does appear to extend all the way through the eye and actually involves the back part of the eye as well. It wouldn't have taken too much more force for there to have been fracture of the skull and even injury to the brain.
It's now time for the critical part of Juice's surgery.
This is it. Poor little eyeball. Just rinsing it out with some saline to make sure it's nice and clean and reduce the likelihood of infection. As sad as it is that he's lost this eye, it will just heal like a cut and there will be a small scar potentially and he'll just look like he's winking. We're done. I'm very happy with how it's gone and I think he'll bounce back really well. We've just got to take extra special care of that remaining eye.
Boy. He's a brave boy.
Come on. Here you go, Roxy, your new home.
Tim Faulkner from the Australian Reptile Park is delivering an orphaned wombat to the Hunter Valley Zoo.
It's your new home. Jace.
Oh, morning, Timmy. How you going?
I'm good. Meet Roxy.
Oh, this is the one you rung me about. What a little cutie.
Is, mate. So I'm swamped. I've got another little wombat, koalas, kangaroos.
Zoo owner Jason has offered to help Tim by adopting little Roxy.
Take good care of her.
She's been living in that?
She has. That's a little pouch.
All right, mate. Well, I might get one of the girls to come and grab her and get her set up and give her a feed and get her organised.
No worries.
Daisy?
There you go. Daisy, meet Roxy.
Oh, she's so cute.
And she's tucked right in.
Thanks.
You ready to get her set up?
Yeah, no worries.
Thanks, Daisy.
All good, mate.
Thanks, Timmy. Thank you for that. Hope you don't think that's it. Got a bit of a job for you.
What do you got?
Only a little one.
Little?
Just babies.
Okay.
Nothing to worry about.
Last time you
Nothing to worry
stitched
about.
me up.
Nah, we're all good.
So exactly how big are these babies?
Well, they're only 12 weeks old.
12 weeks?
12 weeks, yeah.
Jeez.
Tim's brought up a little baby wombat today, so we thought we'd share the experience and let him work with one of our babies. All right, you ready for a challenge?
Oh, yeah, I think so. Jace, truth. It's camels. Great. What on earth are we going to do with camels?
All right, well, these guys can spit, kick, bite, and even squash you down with their front legs.
Jace.
So the plan today is to lead the cows into our holding yards, and then we're going to have to put the effort in to catch the calves by hand, and they're up for drenching, vaccination, and we have to put a halter on them today as well. She's a bit harder to catch, that one.
Yeah.
You got your work cut out for you.
So Jace introduces me to Alice, the stubborn one. I've got to go in, try and grab the very short rope and walk her up to the yard. Hopefully, it's that easy. Okay, I'll go back around. Geez, I'm walking close to those legs. Very easy to want to walk in, isn't it?
It is. You get too close, mate, and she could lash out.
Yeah, she's not cooperating, Jace.
No, you're going to have to try and get her by surprise, mate, and grab that lead. If we don't get them all, we won't get them all in.
Oh. Come on.
Tim's really out of his comfort zone at the moment, so he deals with all his venomous snakes and all this other stuff, but half-ton camels, I don't think he's done this before.
Come on. Hey. Got her.
Oh, well done.
Okay.
All right, so we're going to walk them up the yards.
Hey.
Walk up. Walk up.
I'm not really sure what to do right now, Alice. Come on, this way. Please, Alice, you're not making me look very good.
If they can lead the mothers to the yard, the babies will follow. But Tim's camel is holding up the plan.
You got to try and bribe him with a bit of food, Timmy.
No, I'm just smiling at him out now, mate. Little smile. Come on, Alice.
With Tim, you know, we're good mates, so I'm setting him up to a degree. I've given him the hardest camel, and I'm not giving him any tips at all on how to move him. So we'll see how he pans out. Timmy, you going to take you much longer, mate?
Come on, put that lip down. Oh, it was right up then. Come on, this way. Come on. Come on.
Hello, my darling. How are you feeling today? Hey, how are we feeling? Do you want to come out? Oh, let's have a little look. Hello, hello. Hang on there.
At Sash, it's been just 24 hours since American Staffie Juice had major surgery to remove his left eye.
Come on then. Come on, Juice, this way. Good boy.
After a brutal attack with a screwdriver left the 11-month-old critically injured, Juice has made a remarkable recovery.
Hi, Juice, who's this? Buddy. Hi.
But before he can get the all clear to go home, Laura and intern Grace need to give him a final check.
Well, he's so much brighter, isn't he?
He's been really comfortable.
When Juice came in the other night, he was, in shock. He was whimpering. His eye looked absolutely terrible. Oh, how does that feel to have your head back? Today, he is so much happier. He's definitely on the road to recovery, and I can't wait to send him home with Mom and Dad. Can I have a little look, my sweet? Yes. Oh, boy. It looks so good. This is all stitched up nicely. Yeah. Well, Juice, I think that looks great. And you know what that means? Do you know what that means? We can go see Mom and Dad.
For owners Meg and Todd, it's been a heartbreaking ordeal, and they're anxious to see their brave boy.
All we've been thinking about is being able to finally come and see him again. So, I don't even care what he looks like. I just want to bring him home.
Come on then. Come on. We're going to go see Mum and Dad. Who have we got out here? Who's that? There we
Oh, beautiful. Words cannot explain how happy I'm feeling right now. As soon as we saw Juice's face, with his tongue just hanging out, oh, it's the best feeling I've ever had in my entire life.
Hey, you glad to see Mum and Dad? How much better does he look, hey? You're so happy. So happy.
Laura has prescribed massive doses of TLC as Juice recovers with his relieved and doting owners at home.
It looks like the operation was done a week ago and it was done yesterday. Like, it's amazing how
Such a good job.
tidy it is now, and now it's just keeping it from getting infected, and hopefully the hair will grow over it and he'll just have some tough little scars and a permanent wink.
Okay, Juice, come on then. This way. We'll see you later, pal.
Thank you so much. Thank you so much
honestly.
for everything.
Come on, Juice.
Come on.
Go on, Juice.
Home's this way.
See you later, guys.
Bye. Thank you.
Sad. Juice experienced probably one of the most horrific attacks I've ever seen on a dog, and to actually come out of it how he has is brilliant. Yeah, he might have lost an eye, but he's going to go home with Meg and Todd, and he's going to go on to live a happy, normal life.
Go. Good boy.
I'm so happy. He's so cute.
Come on, Juice.
What did you do with that kitten that couldn't keep its eyes open? Where did she go?
At the Bondi Clinic, overnight rest has seen a remarkable improvement in little Coco.
What did you do with that kitten that couldn't keep its eyes open, huh? When I first look at Coco, I'm almost tempted to scan her microchip just to make sure this is the same kitten. And overall, it's chalk and cheese, isn't it? We're dealing with a different kitten this morning. You do see this with kittens. Their metabolic rate is so fast, things move so quickly in their body that really, if you can give them half a reason to heal, quite often they will take it. So if you can see it, I'm guessing, I'm gonna do this, which I know you don't like. You're gonna wince up a bit, aren't you? Yep, here we go, nice little blink. Pupils are constricting, it's good. It doesn't look like much, but for her to be seeing where I'm moving that white light around and eventually trying to swipe at it, that is the best sign we've seen from her in the last day.
And now there's only one thing on the little battler's mind.
Thank you, I need that. Yeah, for patients that are as severely affected as Coco was, we usually withhold food. I use that a lot, yeah? But now, given they've actually shown these signs of improvement, it's time to see just how hungry she is. Normally kittens, they chew their food before they swallow it, not just inhale it. Don't want to talk right now? I think that's enough food for now. Stomach of yours is bulging. It was hard not to get caught up in the emotion of yesterday when Coco's family came and visited. But now, the really positive thing is I get to call them up and give them the good news. You said you would have to get better. And could you pull through for everyone? And look what you've done. You just will keep on doing what you're doing. Yeah.
Okay, come on. That's a girl.
Walk up.
There you go. Come on, little one. Come on, Alice.
At the Hunter Valley Zoo, Tim has met his match with a stubborn camel.
Come on, I'll just get you started. This way.
The plan is to try to persuade the mothers up into the yard, and hopefully the babies will follow. But obstinate Alice has other ideas.
Alice is eyeballing me. For a minute there, I thought we had a bit of a connection. But she is non-cooperative. Come on, Alice.
I don't think they're going to go any further, mate. Might have to radio some of the boys and get them to come in behind and help push them on.
Just move them up?
Yep, might radio them now.
I'll just stay here.
Okay, good idea.
I'd love to say I'm warming to the camels, but I'm not. I can see they're full of character, but also full attitude. Everything I'm trying, not working. Howdy, boys. We need a hand.
Might get you guys to scoot around behind. Let's see if we can get these guys in the yards.
The reinforcements have arrived.
Whoop. You got to hang on at this point.
Finally, the camels move into the yards, where the babies can be separated from their mothers.
You coming, Timmy?
I'm not tall enough, mate. She's ignoring me. That's a girl.
In this confined area, the real danger now is there's no real room to move, so the camels can kick you nearly in every position you're in.
Okay, make it nice and quick, eh?
Yep. Now's our chance there, now, mate. Yep.
The team has to work fast on this agitated calf.
Up we go.
First putting on a halter, and then vaccinating.
Good. Okay. Ready, guys?
Yep.
Done. It's noisy and it looks stressful for the calf, but it's not. It's very quick. There's not that much pressure on. The calf's crying for mum. That's what it wants.
Bit of drench and then we can let this guy go.
Okay, mate, done?
Done. Right. All right, we'll let this guy go.
Okay, straight out this way?
Straight out that way, mate. So spin that board round to your right. And let him run out.
Go, go, go. You're free, buddy. One young bull down, one to go.
One cow to go.
And I'm shaky.
And she's bigger.
Okay, let's get it done.
You're looking good, aren't you?
At the Bondi clinic, a miraculous turnaround in Coco's recovery means she's finally able to go home.
Chris phoned me today and said she's much better. She was jumping around. She bit his finger. Yeah.
Coco's excited family can't wait to be reunited with their extra special little girl.
Last night at home was very quiet. We gotten used to a little cat bouncing around. She's quite a nocturnal cat, so she usually wakes up at about 2 o'clock in the morning and goes for a run around the house. So it was odd not having her there.
Hello, guys. Hi, Chris. How are you?
Good.
Good. Do you want to come with me?
Yeah.
I think everyone remembers their first pets and remembers just how much they meant to them. So I was never going to be the guy that had to tell those kids that Coco wasn't going home. So there's someone that's demanding an urgent meeting. Look at that little one. What do you think?
Coco.
What do you reckon? You're a pretty good judge. You know her pretty well.
Yeah.
How is she doing?
She's purring.
Yeah.
She's better.
So you're the vet here now. So what do you think?
Much better.
Much better.
Yeah. This isn't the Coco we saw yesterday, right?
No.
Yeah.
She's made a big improvement overnight. Ultimately, she just needed some time to relax, to rest, and try to get everything back on track. But as you can see, I don't think she's back to 100%, but that's a lot to expect within a day. There's no doubt that the brain is by far and away the most complicated organ in the body, so it makes sense that it's going to take multiple days, even weeks, for Coco to re-establish those connections, those pathways that allow her to jump around, to leap around like a normal kitten does.
So the big question for us, does she come home?
You're pretty keen, right? This is where it becomes very hard for me, because how do I say no to you guys? How about we make a deal?
Okay.
So she can go home.
Yeah.
But she can't play with you guys too rough, and I'm led to believe she may play with the dog.
Dog, yeah.
So you can't let her play with the dog for a few days.
Yeah.
So there's nothing more to do than hand her over.
There we go, Tiggy.
She's all yours. Good luck.
Thank you.
Thank you.
As the owner of a kitten that has a similar personality, I mean that when I say good luck.
Thank you.
You're obviously going to have some very good times coming up.
Okay. So yeah, lots of adventures. The adventures of Coco.
Absolutely, yeah. I've got no doubt that this is the first of many adventures for Coco, but hopefully it is the most serious. And from here she does actually mature. She learns to behave just a little bit, because there's that loving family that cares for her a lot. And I'm sure right now they can't imagine life without her.
Okay, down she goes.
She's a lot bigger than the
Same
other
side
one.
again, you want the head?
Yep. Head up that end.
At the Hunter Valley Zoo, it's time to treat the second camel. And this calf isn't happy.
She needs to turn around and get her head facing that way if we
come
can.
on, come on, come on.
Righto, in we go, guys.
Tim and Jason have to fit the calf with a halter and then vaccinate.
Right.
In the neighbouring pen, the mothers are anxious to be reunited with their babies.
We'll go the injection first, mate.
Okay. Catch number 2, and I'm in go mode. I'm feeling good. I want to get on with it now and let this second calf go, reunite them with mum.
Now, bit of drench.
Okay, all done.
Right. Step back a bit.
Okay. There we go. She was strong.
See, there's no other way really to handle them.
No.
You've got to get in close, get into the action and get the job done.
Mate, full on. I thought we were looking at your new camels.
We were, up close.
Oh, that's intense, mate. Calf number 2, done. Hold her on, injected, drenched. Now we can go back in with mum.
Come in there.
We'll let them settle for 5 minutes and then they can go back out. They're ready to go.
Ready to go?
Oh, well, mate. What are you doing? Do you reckon he gets spit on me through there?
He's wondering what we're up to with the babies, I reckon.
Yeah, okay, let's let him out.
All right.
1, 2. Okay. Okay, here we go.
I love having Tim here. It's good stirring him up. I love putting him out of his comfort zone and seeing the look on his face when we set him up for some of these quirky jobs. They're off.
Woof. That quick?
All went well.
Oh, good morning, mate.
Did you enjoy that?
Yeah, thanks for the wombat and cup of tea.
No worries. We'll get you back for the next crazy adventure.
Hello, Owen, hello.
Hey, Chris.
How are you?
How are you doing? I'm good.
Very good to see you.
Good to see
hello.
you.
Hi. How you going? Good. I'm almost nervous to ask. Hi. Where is she?
She's hiding.
She's hiding?
Under there.
And as for little Coco, she's finally recovered from her nasty fall a month ago and is back to her mischievous self.
Oh, look at you. Butter wouldn't melt. When Coco went home, we were all very much aware of the fact it was going to be a long recovery. So I'm keen to see how she's changed. Wow. Oh, little Miss Sensitive. Has she mellowed?
No. No, she's as energetic and full of adventure as usual.
Yeah.
Started climbing everything in the house, up and down, wherever she can go. Loves the garden.
Yeah.
And loves climbing trees.
Climbing trees now?
Yeah. Coco loves heights. She climbs all over the house, climbs onto funny places. Coco's been stuck up a tree 3 times now and requires somebody to climb the tree to go and fetch her and bring her down.
So this is the famous or infamous table?
It didn't come with the socks. The socks is the new safety feature to keep her out. But that's where she got her head wedged down there, and the socks are now there too, so that she doesn't slip down and fall.
But it seems so innocuous, doesn't it? I mean, you look at that, you would never think that a cat would get their head stuck in that, but it just shows you, doesn't it, when they're so adventurous, anything's possible. Trees, tables, huh? And health-wise, how's she going?
Fine, she's picking up weight. Yeah. So normally she's, nearly doubled in weight since we've had her.
Yeah. She'd have a little play with your neck here. Yeah. It's feeling good. It's not catching anywhere. There's no resistance to that. The neck is moving nice and freely there. Importantly, those eyes are nice and open and certainly pointing straight ahead. Has she been clumsy at all since?
She was, when she just came back, she was clumsy for quite a while.
When she stood up, she just start walking full over.
But every day, you can actually nearly by hour see the improvement coming through.
I mean, it's interesting because what you describe is exactly what someone that has a brain injury has to go through is essentially teaching themselves to learn to walk, learn to have that coordination back and teaching the brain to function in a normal way. And it shows you how serious it was for her. To see Coco today, it's so heartwarming to see how much she has recovered, how she is now back to normal, clearly enjoying home life. And it feels amazing. You know, considering the Great Barrier Reef is just a few kilometres away, probably should consider a holiday up here, but for some reason, I always get drawn into working because this clinic delivers some of the most interesting, most amazing cases I ever see.
Chris is on a visit to North Queensland, and not for the first time, he's had a call to see if he can lend a hand at the Marlin Coast Veterinary Hospital.
Hello again.
Hi, Chris. Nice to have you back.
Good to be back. Can't wait to see what you got for me.
Chris's first patient is already waiting, albino rat Marcus and his owner Tia.
This is my buddy Marcus. He came to me about 2.5 years ago, and he was a rescue animal, so he was someone else's unwanted pet. And the moment I laid my eyes on him, it was love at first sight. And we've been like this ever since. So.
Marcus is 2.5, which is considered old for a rat, and has been having trouble breathing.
So he's been wheezing a little bit, and also he's been having like snotty kind of substance coming from his nose, and that can be a problem, especially here in Cairns where the humidity gets really high.
Hi there.
Hello.
How are you? I'm Chris.
Tia, nice to meet you.
Who's this in here?
This is my friend Marcus.
Hello, Marcus.
Yeah, he's an albino rat.
Hello, buddy. All right, do you want to come through then?
Yeah, sure. Thank you.
Normally I associate Cairns with big dogs, with the occasional cat, and big reptiles, like snakes and crocodiles. You don't normally expect to see rats. So what's the reason that Marcus is in here?
I'm very worried about his respiratory problems. He seems to be having a little bit of wheezing from his lungs, and also there's been a fair bit of porphyry coming from his nose.
So he's had weeping coming out of his eyes and out of his nose. If rats have a weakness, it's probably their breathing. They are renowned for developing a respiratory illness that causes them to have a lot of difficulty getting air in and getting air out. What's interesting is that, you know, he has moved about 20 centimetres altogether, but it looks like he's been for a run.
Yeah.
His eyes are shut quite a bit too. So he just looks a bit run down. Well, let's have a listen to his chest. Could I get you to hold him there for me? Okay, I can certainly hear more noise coming from his chest than I should. So rather than the air coming in and out very smoothly, it comes in and out with more sound. So it sounds rougher. And that's usually because there's a build-up of something in the airways, so that the flow of the air is partially blocked. When I'm listening to Marcus's chest, I'm not hearing what I want to hear. When you hear good, healthy lungs, it's like a calm breeze just flowing in and out. But in his case, it's like a drinking straw at the bottom of a can of drink. There's a lot of turbulence, and the air is being forced through narrow airways that have little blockages in there. So the big challenge at the moment is just working out exactly what has caused it. And obviously how we can treat this issue, because my fear is that if we don't do anything, given Marcus's age and condition at the moment, then this problem could get worse, and could get worse a lot more quickly than we want.
Oh! Hey, settle down, buddy.
It's alligator breeding season at the Australian Reptile Park, and the lagoon's residents are in a feisty mood.
Hello. I got a bit of a surprise for the reptile keepers today. Half-tail, this female alligator, has laid her eggs last night. And she's not just any female. She's small, but she's the crankiest female in the lagoon. I'm gonna have to go and break the news to the keepers that we got to get some eggs out of that nest. But first we got to get past her.
General Manager Tim Faulkner has gathered a crack team to tackle one of the park's most dangerous jobs.
So let's just hold up here a minute and just have a talk about what we're going to do. So it's that time of year, gator nest raids.
So what, you got a gator coming up here?
Eggs or hungry? We've only walked 10 metres into the lagoon and we've already got a female hassling us. This could get a bit interesting. Well, it's that time of year, so we got hungry gators and we got nesting gators. So today we got half-tail. Has anyone not raided half-tail's nest before?
I don't think I have.
She's nuts. She's not the biggest gator in the lagoon, but she'll give you a good 2 to 3 metre lunge. So just be prepared for that because we're working in a pretty confined space today. Bill, you and I rope.
Yeah.
Mike, Renee on the back. Zach and Bill on the water. Keep those gators away. I'll get in and get some eggs. Hopefully it's a smooth process. There are two reasons that we need to rescue the eggs. Firstly, it's much hotter here than where gators live in the States. We leave the eggs in the nest, they overheat and die. Secondly, gators are cannibals. There's 40 in there. If the little one's hatched, they'll eat them. Okay, so she's already up on that nest, guys. So we haven't got a lot of room to work here. I think to start with, Mike, Zach, Renee, just head down, guard that water. Bill and I'll go up, just try and secure those jaws, and then we'll all be a little bit happier. Fair to say, we get a buzz out of working with gators. But it's important that we have a brief and that everyone just remembers their roles and goals because that's what saves your buddy's life and that's what stops Halftail from getting hurt. Okay, we ready to rock and roll, guys? Yep. You want to turn her? Just, Bill. You stop her. I am. Halftail's only objective is to defend the nest. Now, in the wild, she'd have things like feral pigs trying to raid it, monitor lizards getting in, other gators. Her job is to keep us away. We got it. Close. Nah. Watch, there's a big lunge coming here.
Something's going on inside those lungs to make breathing very difficult for him. The worry I've got is that he's not a young rat, and for him, breathing is already becoming harder just with older age.
At the Marlin Coast Veterinary Hospital, Chris's first patient is Marcus the albino rat, who's having respiratory problems.
My feeling is we're either facing a bacterial pneumonia or a mycoplasma pneumonia, which is a little organism that's not really like a bacteria and not really like a virus. It's kind of in between.
I knew he had a little bit of wheezing happening, but I wasn't expecting it to be as big of a health problem as Dr. Chris explained that it was. That definitely hit me hard when Dr. Chris said that he is quite sick. What can we do for him?
So we can treat that with antibiotics, so with some medicine, which will help. But you can treat all those bugs in the chest, but unless you help the body to get them out and to get rid of that mucus and to make breathing easier, then you may not actually see any benefit. The simple fact is that he needs help to get that mucus out of his chest. If it just stays there, his breathing will stay the same. The way I'm going to get the mucus out of his chest, it may raise some eyebrows. I think we should nebulise him. So what we're going to do is allow him to breathe in a mix of saline, but also a tiny little bit of antibacterial disinfectant.
Oh, that sounds amazing.
So when that happens, the mucus absorbs that fluid, becomes a little bit bigger, but also a lot more moist. And that way he can actually cough it up and bring it up himself.
Fantastic. Sounds really good, Doctor.
Yeah.
I have to say that I was fearing for the worst, of course. So treatment-wise, anything for him. I would do absolutely anything for him. He's part of our family. Sounds good. Off you go, darling boy. Mom will see you soon.
We got it. Close. Nah. Watch, there's a big lunge coming here. We right?
At the Australian Reptile Park, Tim and his team are trying to restrain a super aggressive female alligator.
Got it. Oh, grab that with my thumb. Okay. Gators are really different to a saltwater croc. If this was a saltwater crocodile yard, we couldn't be in here. But what gators lack in aggression, they make up for in jaw strength. One of the strongest jaws on Earth. Not too far forward, let's let her walk back a little bit. You got Halftail defending that nest. If she bites one of us, she's going to bite with real intent and not let go. Okay. Whoa. No other gator like that.
No way. She's like a croc.
Okay. You guys feeling good? One.
Wait.
Whoop, whoop. You just watch those hands in the mouth, mate. Righto, 1, 2, 3. That's it, well done. You tell us when you're right. Yeah, good. Okay, let's get that. Bill, I'm gonna hold rope. Yep. I'm gonna put some tape on there.
Yep. Just watch his bit. He's about to go.
That's good. Okay, Bill, you wanna shut him? Now it's time to tape the mouth. You've got one of the strongest jaws on earth. If a limb goes in it, it's not coming back out. Once the mouth's shut, it's a little bit safer.
Yep.
All right? Good stuff. Halftail by far has more energy and fire than any female in the lagoon. But she's not the biggest, she's just got spirit. Everyone right?
Yeah, mate. Boy, Timmy, we've got gators coming up here.
Big gator.
Boy, big boy.
Keep him back, mate. Zachy, you watch that one.
Come on, mate.
EW for breakfast, Mike. Everything happens really fast and you have to keep moving. The gators in the water think it's feed time and they're already coming up. Thankfully, Bill's there and he's just holding them off. We good?
Hold up, hold up.
Hold up.
Hey, Shannon. Hey,
Chris.
I want to nebulise little Marcus here.
Okay.
You don't have little rat masks, I'm guessing?
Probably not small enough for him, no.
Do you have like a box, even like a little storage container?
Yep, I'll
Okay.
find something for us. Yep.
Thank you.
In North Queensland, Chris is trying to help a pet rat that's struggling to breathe.
Nebulising certainly makes sense to me, but how are we going to get that fluid into his chest and have it work its magic? Well, I've got some ideas. Okay, so we've got our mask, which is the box. We just need our nebulizer and our liquid. The whole goal here is to put moist, sterile, antibacterial air into Marcus's lungs. Now I've got my storage box, all I need to do is make up my magic solution. Okay, so we'll take 2 mils of this. The solution I'm using is 1 part antibacterial liquid, 250 parts saline. Add that together, mix them together, and find a way to get them into his lungs, and all of a sudden, we're nebulising.
We'll pop it in.
I think this is going to work. So, you create a bit of a seal, and then if we put this in here, wedge that through there. Okay. And all of a sudden, Marcus, you've got your own personal steam room. Okay, let's start.
All right.
So straight away, we're already starting to see some water vapour appear in the tube, find its way into the box, which is perfect. The challenge is now trying to find a white rat in amongst white fog. It's a total whiteout in there now, but importantly, he's breathing comfortably and he's getting that medicine right where he needs it. You know, anyone that's been into a steam room knows when you come out, your chest feels kind of clear, and that's all because that water vapour is helping to loosen everything up and really open up your airways, and hopefully that's exactly what's happening with Marcus right now. The only giveaway that he's still in there is the fact his little tail's just sneaking out the side here.
Oh, there it is.
But the rest of him's disappeared. It sounds strange to say this, but my hope is when Marcus comes out of this box, he's actually going to be coughing and spluttering. The whole idea there is that his own mechanisms are kicking into action. They're actually removing that build-up of mucus, and his airways have already expanded.
Out in reception, owner Tia is anxiously waiting for news of her beloved pet.
Being apart from him is indeed very hard. So hopefully Marcus is feeling much better after the treatment. I'm looking forward to getting him home.
All right, that is it. So Marcus, you in there? Yeah, hi little buddy. As I open the lid, a big waft of steam escapes, but through that mist, I see 2 big red beady eyes staring right back at me. And that's a good start.
Hey, Marcus. What happened, little buddy?
Okay. So I can really hear that his breathing certainly does sound even more moist than it did before, but that is actually a good thing. That was the whole idea of the process, was to try to, if you like, lubricate his airways, make sure that mucus was able to really slide back out. You just need one more thing, a little shot of antibiotics.
Sorry, little buddy. It's okay. It's okay. Oh, there we go.
There you go, little man.
Well done, huh?
You are good, aren't you?
Well done.
Yeah. Those eyes of yours are a lot wider than they were before. It's got to be a good sign, isn't it? You're more active, aren't you?
He seems a lot happier now.
Yeah. But you're not happy with the hair? Well, how do you do it? Oh, you brush it forward. While I'm worried about Marcus's health, he seems more concerned about something else. His hairstyle. Just making some adjustments. You look good. Should we go back to Mum? Yeah? In a short period of time, we've managed to turn around what could have been quite a serious health issue for Marcus. And now, he's free to go back home and live what should hopefully be a long and happy life with Tia. Look who I have here.
Oh, my boy. My little boy.
He's all steam clean too.
Oh, beautiful. Look at that. Oh, he looks beautiful.
Yeah, those eyes of his are a lot brighter too. Given how much Tia clearly cares for Marcus, I know she's going to be a hard marker. But thankfully, the moment they're back together, she seems thrilled. And Marcus, going on those big red eyes, looks equally as happy. So he's been a little bit spluttery, which is good. It means he's starting to clear out some of that build-up. But importantly, he's really active, he's really busy.
Oh, good. Yeah, he's looking much better.
Yeah, so it's telling us he's getting a lot more oxygen into his body. There's no doubt that Marcus is a unique patient and he's had a unique treatment today, but his relationship with Tia is no different to any other pet. And now, thankfully, both of them can breathe a lot easier. There you go. All right, he's all yours.
Thank you so much. Thank you.
All the best.
Just hold up, guys. Googly's just coming in through the back here.
Okay, we got a second male.
He'll give us a bit of curry. Yep, hold him back.
At the Australian Reptile Park's Alligator Lagoon, the annual nest raid is being interrupted by some ferocious intruders.
Feeling a little vulnerable here, Tim.
You are vulnerable, mate, but you got good boys on it. Okay, so I'm gonna head in and get these eggs and get it over and done with, hey?
Righto.
We've caught Half-Tail, she's under control. The gators are being held back at the water. My job now is to get the eggs. With these gator nests, I mean, this is an impressive nest. It's massive. And all this vegetation's built up by Half-Tail, and as it decomposes, it creates the heat that incubates the eggs. So my guess is that the eggs are there, and I hope they're there, because this is a big nest to have to search through. Bill, I'm digging and digging.
It's a massive nest.
Got him. Found the bunch. And a good looking clutch, perfect. And the thing is, with reptile eggs, their membrane attaches to the shell. So if you roll the egg, you essentially turn the baby upside down, you can kill it. Let's say a chicken egg, it has a floating membrane. So the chickens roll their eggs for incubation, but critically, with gator eggs, a bit of dirt goes in the bottom, and each precious little egg comes out exactly like it was. How are we going down the water there, boys?
Yeah, we still got a couple trying to come up, but we're holding them off pretty well. The big male that's coming up at us is Googly Eye, which is the biggest alligator in the lagoon. He's 4 metres and almost half a tonne in weight, and he's got a full-on attitude to go with it.
Renee, you looking after Mike?
Yep.
Hold tight, mate. Won't be long, Mike. Are you all right?
Yeah, mate.
We're up to 40.
Nice.
Now, the eggs, they're not like a lot of reptile eggs that are soft and rubbery. They're really porcelain-like. The best part about this clutch is they're fertile. We can tell that because of that white band across the top. If they're infertile, you won't see that.
While Tim is busy collecting the eggs, keepers Mike and Renee are struggling to hold the mother alligator.
It's a really tough gig on the back of a gator. So Mike and Renee have to be able to manage her when she starts to squirm. If she went back in the water with the tape around her mouth, that's a nightmare. So it's a tough position to be in, but they're doing a great job. Yeah, I'm going to give you a hand for a sec, mate.
It doesn't help when you get a cramp in your leg. I feel a little bit more comfy if we brought you this way. Can you work with us, Mike? 1, 2, 3.
Again, 1, 2, 3. There. Mike is on the back of a Half-Tail. He's got a cramp in his leg. It happens because it's a really awkward position, but he just has to get through it. Righto, total count, 50. Oh, no, I've spotted one more. 2 more. 52.
One off the record.
Hurry up, man, that's a big clutch.
Once Tim has filled the chamber back in, Halftail won't know the clutch has been moved. But importantly, her precious eggs will now be safe.
All right, that's full. She won't know the difference. One gator to let go, and we're finished.
At the Marlin Coast Veterinary Hospital, reptile keeper Kirsty is bringing in a prized exhibit.
So today we've got one of our Fijian crested iguanas here from Cairns Tropical Zoo. He's not looking as bright and perky as he normally does, so just bringing him down to get a bit of a check-up and see what's going on.
How you going?
Hey.
How are you? I'm Chris.
Good. Christy, how are you?
Nice to meet you, Christy. Have I seen him before?
I think you might have, yeah.
He looks very familiar. Slightly different colour, but
Yep.
he does that.
He does indeed.
Come on through. I don't see too many Fijian crested iguanas, so when I see this little guy, I'm thinking, hang on. Now, when you're one of the rarest animals in the world, you don't forget a face.
No.
It's Aku, isn't it?
Yep, definitely
Yeah.
Aku.
Wow. Hello, buddy. Wow.
6 months ago, Aku was brought to Chris after the endangered lizard's keeper became concerned about his health.
His appetite's gone down and he just hasn't been himself lately. Hasn't been eating as much as he normally would and nowhere near as active as normal.
An X-ray revealed an enormous bladder stone was the cause of Aku's trouble.
Wow, that's not what I expected.
Chris's only choice was to remove it surgically.
How's he doing at the moment? Obviously, you're back for a reason.
Yeah, he's not so good at the moment. He was doing fantastic after the last surgery, but he's just in the last week or so dropped a lot of condition. It's a little bit flat, a little bit darker in colour, which usually means something's not quite right.
Yeah, I know they've got that ability to change their colour, but he's certainly a lot darker.
Yeah, he's not a happy lizard at the moment.
No. He definitely looks skinnier to me.
We're quite concerned about him. Aku's been with us for quite a long time now. He's been there the entire time I've been there. He's one of the first Fijian cresteds I worked with, so he is, one of our senior lizards at the zoo, so he's a favourite. He's very friendly, often comes out for photo shoots, and he's great for the public to have a pat and have a hold and get up close with them, so it's, we're all quite concerned about his welfare.
So is he eating at the moment?
Not really, no. He's just sitting on the bottom of the cage, head down, not happy.
So not really into his food, a bit more lethargic?
Definitely more lethargic, yeah.
All right, probably the first thing I would do is just get a weight for him. He was 350 grams last time he was in.
Yep.
Okay, 245.
That's a considerable drop.
Yeah. So he's essentially lost almost a third of his weight.
It's a lot.
To lose a third of your body weight over just a few months, that's a big change and a big cause for concern.
Okay, tape is off, knife away. Mikey, your legs working?
Just hold up. Gator coming in.
At the Australian Reptile Park, the gator nest raid has produced a massive clutch of 52 eggs, but the danger level is still high.
The plan is, Billy will hold the jaws of the gator shut, Renee comes off, 1, 2, 3, I pull Mike off. Sounds simple. Okay, Nay off for a sec, and Bill's lifeline. Ready for Mike? 1, 2, 3. And I headbutted Bill. Just watch out there. You all right? We sustain a headbutt.
He split me lip.
That's a new one. When I've grabbed Mike, I might have pulled back a little bit too hard because his head's ripped up, whacked Billy in the mouth, we got a gator in the middle, and you never know what's going to happen. Just a look at your lip. You're on report. Hey? We're out here catching gators and Mike's throwing headbutts. Nah, good job, guys. That was a hard one to do. Well done, especially to Halftail. Well, she looks happy, hey? Okay, I'll get these eggs up. So the team's job is done. For me now, I've got to get the eggs up to the incubating room and set them up where they'll sit for the next 2 months. There you go, little guys. Now this is an incubating container. Now, we have to artificially simulate what it's like in an alligator's nest. And we're a reptile park, so we've got lots of reptiles, lots of eggs. This whole room is one giant incubator, between 31 to 32 degrees. All I've got to do now is get the eggs from here into here. Just got to keep each egg up almost exactly as it sits. I've packed a heap of dirt between the eggs so that when we carry them, they don't rock and roll too much. They just stay in that position. It is warm in here. I'm sweating. And I've had to use 2 containers. I mean, 52, that's a big clutch. And that there is our last little precious egg. Now I've just got to put them on the shelf, wait 60 days, and we have little alligators chirping one morning. Well, good luck. I'll see you little blokes in 60 days.
So we know he's lost a lot of weight.
Yeah.
I guess the first thing we should check is whether we can feel a similar problem to what he had last time.
Yep.
Whether there's another bladder stone there.
At the Marlin Coast Veterinary Hospital, Chris is examining a familiar old patient, Aku, the Fijian crested iguana.
Looking at Aku's face, it's clear that me feeling around his belly, it's a major inconvenience for him, but obviously it has to be done. The key here is identifying if he's had a recurrence, a return of that bladder stone issue. I can't really feel anything in there that's suspicious.
Well, that's a good start.
Yeah.
That's definitely a good sign that it's not a new bladder stone. That was a real issue last time.
Yeah, look, his heart rate's slow, which would certainly fit in with him being just a little flat.
Yeah.
Breathing's okay. Not brilliant, but okay. Let's just have a look at his hydration as well. Just pinch the skin there. Just see what happens. Yeah, his skin certainly is tenting.
Yeah.
I would say he's dehydrated.
Yeah.
The food that iguanas eat is often quite high in water, and it's where a lot of their hydration comes from. So for Aku to be looking so dehydrated, it almost makes sense, because without the food, he's not getting the water. We know he's dehydrated, we know he's underweight, we know he's lethargic, we know his general metabolism is slower than it should be.
Yeah.
I think the best thing to do would be to give him an X-ray.
Yep.
And just see exactly what's happening internally and check that there's not a little bladder stone developing, or he doesn't have some sort of internal problem that we're not seeing from this physical examination.
Yep.
Hey Lisa, look what I got.
Oh my goodness.
My new puppy.
It's yours?
Yeah.
Hello. Hi, what's your name?
Ponyo.
Ponyo.
At Sash, vet nurse Steph has surprised Lisa with a visit from her new 5-month-old pug.
Hey, you're such a cutie pie. You're such a cutie. Have you just come to visit us at work?
Yeah, could you vet check him, please?
Oh, you've just got him?
Mm-hmm.
Oh my goodness, you're a real newbie. Hey? It's really important that when you get a new pet, whether they're young or old, that they have a vet check. I need to make sure that everything's healthy from this little guy, even though he looks bright and energetic. My goodness, well, you get an A+ for cuteness, that is for sure. All right, now you're gonna sit still so I can actually check you out. I'm examining him from top to tail, checking his head, his heart, his tummy, making sure that he's healthy. Ears look good. See, had any issues at home?
No issues.
Oh my goodness, just issues of craziness.
Yeah.
Huh? Is that it?
He's my first dog out of home. He is a handful. Having a dog is a handful. I have 2 cats, so they get along all right together, as long as he doesn't annoy them too much.
Hey, cutie pie. I need to look at this squashed face. I need to look at this squashed face that we love. All right. His nostrils are a little bit narrow. Is he pretty snorty?
Yeah.
Yeah. While Ponyo's short nose and squashed face looks adorable, he actually has quite narrow nostrils. Now that's going to prevent him from getting enough air into his body, and as he gets older, that can lead to breathing problems. Yeah, I can hear him snorting away.
Yeah.
Hey, we might need to fix those nostrils down the track.
I'm glad I've picked this up early because Ponyo's going to have surgery in the near future to be desexed, and at the same time it's a good idea that Steph has his nostrils widened so that he'll be able to breathe better and hopefully prevent any breathing issues later in life.
Well, my friend, apart from your narrow little nostrils and your excess manhood back there, you look pretty good. You look pretty good. Hey?
It was what I expected. All pugs seem to have quite small nostrils, and I would rather get it fixed now than at a later age and see him struggling to breathe. Otherwise, Lisa told me he's all fine and he's ready to go home.
All right, buddy. So, in the near future, have him desexed, have them operate on his nose as well, and then that's gonna be much better for you, hey, buddy? It is. All right.
I always love it when staff members get new pets because they become part of our family too. And for Steph, this is her first dog, and I'm so excited for her to enjoy the next many years to come.
Thank you for checking him over.
No problem. My pleasure. I'm always happy for a checkup and some free cuddles, hey? Cutie pie. You're a cutie pie.
All right, so this is Aku. He needs an X-ray. So I'm just checking whether he's had a recurrence of a bladder stone problem.
Yep.
Or whether there's something else going on.
At the Marlin Coast Veterinary Hospital, Chris is treating a familiar old face.
It's probably no surprise that I don't see too many Fijian crested iguanas. So to have a second look at Aku, it's a bit of a pleasure. So I need to maybe use that box and just make a little barricade so I can actually get a good shot.
Yeah, sure.
Can you give me a box cutter?
Yeah, sure thing.
For such an unusual patient, Chris needs to make some unconventional adaptations to the X-ray table.
The best way to keep a lizard or an iguana still is to make them feel like there's nowhere else to go. A four-sided box without a base is the best way to do it. It's not my finest surgical work. Okay, you've had one of these before, haven't you? This will essentially be a full body shot that's really focused on the abdomen. That's where I'm most concerned we may see something abnormal. X-ray. Given the fact Aku's lost almost a third of his body weight in just a few months, I'd expect the X-rays to look dramatic. You want to watch? The thing that I'm really checking for here is, first of all, the bone density, really how white the bones are, which is normal. And then immediately my attention gets drawn here. There's a collection of little white dots here. Now that could be the very start of another bladder stone, but his bladder shouldn't be that far forward. So what you sometimes find with iguanas is they're quite experimental when it comes to their digestion, and in this situation I'd say that Aku has picked up little bits of grit, tiny little stones, and swallowed them, and they're actually sitting in his intestine there. It's actually normal. That would not be causing him any sort of problem whatsoever. So across the whole X-ray, there's nothing there that shouldn't be there. So you can say that when it comes to his internal health, he's actually looking okay. What I'm convinced we're looking at here is a real combination of factors. Aku, being a cold-blooded iguana, hasn't really found a way to get his metabolism kick-started after the colder months. Add to that the fact that he's old, and really he's just struggling to get his whole system firing. Christy, you ready?
Chris can now pass on the good news to Aku's keeper, Christy.
Here's your boy. And on the X-rays, what we found wasn't actually too much.
Okay, that's good.
That's good news. The X-rays showed him to be quite normal.
Yep, great.
But I just feel like his whole metabolic rate, his whole body system hasn't really been firing.
Yep.
And so the idea is to try to give him a bit of a boost.
I got a little bit nervous waiting to see what was going to happen, whether these the stones were back, whether there was something more sinister going on in there. But luckily it looks like it's all turned out quite well. It just seems to be age related, which is fantastic. That's something we can manage and get this little guy back on track.
So we'll start with the fluids. First up, Aku needs some fluids. This is saline, and the whole goal here is simply to rehydrate him. This one is his antibiotics. As a bit of extra insurance to really help his immune system along, I'm also going to give him a shot of antibiotics. So he's not going to get all of this. Just going to get 0.3. The best treatment for Aku, considering his condition, is actually vitamins. Vitamins in reptiles are incredibly successful at kick-starting the metabolism, getting them interested in food again, and really lifting up their heart rate and getting them up and going. So we're giving those B vitamins there. Last one. So this one's vitamin A, D, E and C. All right, and after that, I think we can pretty safely say he's fully covered.
Fantastic.
All right, so it'll take a few days, but I would hope that you'll start to see a bit of a boost.
Yep.
It's kind of just a bit of a reality check for him that he's not as young as he used to be and probably not as young as he thinks he is.
Definitely.
And by just helping his own body system along to get moving again, then I think you'll find that the appetite should return and he should really start to show a bit more strength and a bit more fight.
Sounds good. Hopefully it works. Hopefully this little guy will be up and nice and perky again and be back out interacting with all the customers and guests at the zoo. He is one of our little favourites. He's very bright, he's very colourful. Everyone likes to come up, give him a little pat and maybe even feed him a hibiscus flower. So hopefully he'll be back out there in no time.
It's nice to see it, but just not as often. All right. See you, mate. I'm sure in the back of Christy's mind, when she came in here this morning, she would have thought, oh no, it's all happening again. Aku is going to need another major operation. Thankfully, that hasn't been the case. All right, I think he wants to leave.
Fantastic. Thank you for your help.
He's heard enough.
He's had enough. Awesome.
All right, see you later.
Thanks for that.
Take care.
Bye-bye.
Bye-bye.
It's been 9 weeks since our little gator eggs were laid. Any day now, they're due to hatch. It could be today.
Listen to that. At the Australian Reptile Park, it's an exciting day.
Here we go. Look at that. Listen to that. That's not something you want to hear in the wild. That means Mum's coming. I'm your mum for today. Come on, I'll help you out. You've all hatched well. And those little cries for help, they call out to Mum. And when Mum hears that, she would go up to the nest, dig it up, she picks up the babies so gently in her mouth and she carries them down to the water. And that's exactly what I'm doing, taking them from the nest into some water, they have a rinse off, get rid of all the yuck from inside the egg, and now I'm going to take them to their new home. Hello, little fella. You're tiny and you're white. Look how small he is. You can be Harry the hatchling. You're going to need a bit of extra care, hey, mate. Look how white he is. And my guess would be if he was in the wild, he'd be the first one to get eaten. He's a very vulnerable little fella, but luckily, we can look after him. Hey, mate, it's your lucky day. In you go. Look at you guys, ready to go. Here's your new home. You ready to go in? The baby gators will be in this little enclosure for about a year. And after a year, they'll maybe be 40 centimetres long, at which point they need to be moved up a grade in cage. And it's a very slow process because they're not at maturity until about maybe 10 to 20 years old. Here we go. They're jumping off these little ledges and hitting that water. They're up and their eyes are out, and this is the start of their new life. Listen to the calls. Even in here, they're still calling for Mum. They know now this is their home, this is where they're going to live, and they're just checking that I'm still here. Now you guys, don't pick on Harry, please. Hey, what, you want to stay with me? You want to stay with me, righto? You stay... There you go. See you guys. I'll bring you some food a bit later.
Hey, mate. Tim Faulkner is responding to an unusual emergency.
I've been called to the marina because a fisherman friend of mine has found a turtle floating in the middle of the ocean. As soon as I hear that, I know something's wrong. The turtle needs help.
Here's our little fella here.
The skipper hands over the turtle, and I'm shocked. It's a hawksbill. They're critically endangered. And this guy's in bad shape. He's got lacerations, barnacles all over him. He's on death's door.
Can you lift that towel back? Yep. Tuck it over him. We've still got a bit of kick.
The only thing on my mind now is getting this turtle down to Chris at the Bondi Vet Clinic. He'll know what to do.
All right, mate, I'm going to get him up home. No worries. Good on you. Good luck. Hope it goes well.
Thank you. I just hope that the turtle can hold on that long.
Be okay, little girl.
I know. At the Bondi Referral Hospital SASH, concerned owner Sean has brought in 5-year-old Frankie.
In the last couple of days, we've noticed that she's presenting with basically a loss of the ability to walk and maintain her balance. It's a bit painful to watch, so we thought we'd bring her and get her fixed up.
Hello.
Hi.
I'm Lisa.
Hi, Lisa. How are you? I'm Sean.
Sean, this must be Frankie.
It is.
Hi, sweetheart. Hey, what's going on with her?
She seems to have had a bit of a relapse with some spinal issues.
Okay.
A lot more severe than the first case we've had with her previously.
Okay, so when did it start this time?
Really severely, probably in about 2-3 days ago.
Okay. Well, why don't you pop her down on the ground so I can have a look at her walking around.
Right, there we go.
Come here. This way. Oh, she's very wobbly.
Yeah. She's never been that bad before. Give me a friend.
It's worrying how Frankie is stumbling and falling over so often. It's almost as if the nerves from her back legs are not communicating properly with her spine.
Good girl.
That's a girl. She feels her toes very well, which is a good sign. But she's certainly falling all over the place and something's not working. Now, the most likely thing that she's got is a slip disc because she's of the breed that gets those sorts of things, but I can't rule out something else, something more sinister.
Yeah, okay.
Frankie will need an immediate CT scan so Lisa can work out which part of the spine is affected.
You're going to give Dad a little cuddle?
Too stressed, give me a cuddle. You'll be okay, little girl. You'll be okay.
Because Frankie's signs have progressed so rapidly already, my concern is that she's going to deteriorate. If we don't treat her and act quickly, this dog may never walk again.
Timmy.
G'day.
Full surprises, aren't you, mate?
Hey.
Come straight through.
She is.
Tim has arrived at the Bondi Clinic with a critically ill hawksbill turtle he's named Fluky.
Right, let's get it up here.
I know a sick animal when I see one, and this little turtle is in real strife. I really hope that Chris can do something and give her a chance at recovering.
So from what you know, she was found floating?
Correct.
Where?
40 kilometres offshore from Terrigal, just a little bit south, so basically straight east of Sydney.
Wow. And she is, what, at least 1,000 kilometres further south of the absolute limit of where she should be.
At least she's stuck on an ocean current, I guess, and too weak to fight it.
Tim's done absolutely the right thing in bringing Fluky in. I mean, straight away you can see she's in bad shape. But when you hear that she was found floating, well, that is a serious cause for concern. Those barnacles and this build-up of algae says that she's been floating for quite a while.
Yep.
And these guys feed off the bottom, usually grabbing the sea sponges and sea grasses and algae. So, I mean, she would not have eaten for at least a month.
But no nutrition isn't this little battler's only problem.
There's ballooning out of her skin here, which is quite strange. That's not something you normally see. So whether she's underweight and the skin's then become loose and doubled up around her neck, that's possible. Or there could be something else going on internally. You know, we've got what looks like an abscess here as well.
Yep.
And that's just underneath that nasty cut on the flipper. I think a lot of what we're seeing with her is the result of her bobbing around in the ocean for a long time and not being able to go down into the water, and she's been exposed to the wind, she's been exposed to the sun more than she normally would be.
Everything's just taken its toll.
Yeah. It's just amazing that Fluke is still alive. She's obviously got a strong spirit. She's a fighter. I just hope she can hold on and go a little bit further.
And she's got a big battle on her hands here. The tragedy would be if she's come this far and then we lose her now.
Hey, Frankie. Come on, darling. Good girl. All right, this is Frankie.
Hello, Frankie.
At SASH, Dachshund Frankie is about to undergo a CT scan. Lisa has called on the expertise of specialist surgeon Sue Kwan.
She's had spinal problems in the past and she's wobbly, she falls over.
Okay.
Okay.
We'll do a scan.
Perfect.
Because Frankie's deteriorating rapidly, we have to do a CT scan right away. Firstly, to work out exactly where the problem is and make sure that it's nothing more sinister like a tumour.
Yep,
there we go.
There it is. That's a pretty simple diagnosis, isn't it?
Looking at Frankie's CT, it's pretty obvious that she's got a slipped disc. It's squashing about 60 to 70% of her spinal cord, and I can't believe that this dog can still walk.
That's significant. If we don't treat that quickly, she could be permanently paralysed.
Frankie's devoted owner Sean has already given the go-ahead for immediate surgery.
She's a massive part of our lives, so as soon as something was wrong with her, we didn't really hesitate. It was just get something done to help her.
Let's go. Hey, let's get you fixed up.
Charlie, I'm just reading him a story.
I think Charlie's very pleased that you're here, Harry.
Louise and little Harry have arrived at SASH with 9-month-old Charlie. The chocolate Labrador is having trouble with his front legs.
So we threw a ball at the park and he chased after it and he took a bit of a tumble, so he just picked it up really awkwardly, and then when he got back up again he was walking off but he was limping quite heavily.
He loves licking people's hands. I don't mind that anyway.
Harry is heartbroken to think his best mate is in pain.
It means that he can't run at the park now. That means I can't even get any exercise. I can only get exercise walking, not running.
Hello, Louise.
Hello.
I'm Stephen. How are you? Nice to meet you. Hello, Harry. You good? Is this your dog?
Yeah.
What's wrong with him? He's got a sore elbow, has he? Well, we better have a look into that. What do you reckon? Do you want to come and help me? I'm going to need some help. Come on, then.
Come on, Charlie.
2 sore elbows. Doubly as bad.
I never thought this would happen. You know, he's a puppy, you know, he behaves like a puppy, he chases after dogs, he runs after Harry. And now he's stuck walking the streets on a lead and can't go to the park anymore, and it's pretty sad, actually.
Come on here, Charles. Let's have a look at your legs. And this is his relatively good leg, supposedly. Shoulder seems pretty good. Let's have a look at your bad side, buddy. All right, we're going to look at the bad one now. Yeah, so he doesn't like that. So I think Charlie's probably more sore than he's letting on. He's probably got a little crack in the bone on the inside of his elbow joint. And what that's causing, every time he walks on it, that little crack is moving a little bit and causing him pain. And ultimately it damages the surface of the joint, the cartilage gets damaged, and he ends up with arthritis.
Charlie will need an immediate CT scan.
I just thought it was the sprain, maybe be on some anti-inflammatories and that would be that. Like, I never realised young dogs could get arthritis at 9 months of age. I thought that was always something that happened in, you know, older animals. So, yeah, it's a real shame.
This is about as bad as it gets for a turtle.
She's not looking good, is she?
She's not.
Hawksbill turtle Fluky is a long way from home and in serious trouble.
It's remarkable that she was found.
Yep.
It's even more remarkable she's still alive considering what she's been up against.
The critically ill turtle was rushed to the Bondi clinic by Tim Faulkner after being found floating out at sea.
We're getting a pretty clear picture of the outside of her. You know, we've got a nasty gash on this flipper here. We've got a little abscess underneath. We've got a lot of sunburn. And we've got just a collection of barnacles and algae on the surface. So there's no doubt the outside of it really worries me. It's what's inside though that's caused all this. So I think the next step is to actually put a needle into her body cavity, her coelom, and just see if we can find either air or some sort of fluid. And if that fluid's passed, then we know there's an infection that's in her body. There's just a little there.
Doesn't look pretty.
No, it doesn't. It does look like we've got some sort of infection in her body cavity.
Right now, all signs are pointing to the fact that Fluky may be suffering from something called floater syndrome. It's quite mysterious, and what we usually find is gas building up underneath the shell, usually in the gut. Quite often it's caused by an infection, but to really diagnose it, I need to do an X-ray. And to do that, I need to get creative. This might look a little bit strange, but really it's the only way of getting the shot that we need. And most importantly of all, it doesn't hurt Fluky whatsoever.
Okay. Happy? X-ray.
What do you got?
Wow. See that?
I see a big black area.
So normally in a turtle, their lungs are about there. So just a small space like that. Here, over half, or probably 3/4 of that body cavity is air.
Air?
So she's a floater. She's got floater syndrome.
Yeah.
The fact that we're pulling pus out of that body cavity says that she has an infection in there. That could have been the initial cause. That is the X-ray of a really, really sick turtle.
Yeah.
What Fluky really needs right now is an antibiotic injection. That way she can start fighting this infection straight away.
Even though she's a turtle, she's no different to any other animal. They get dehydrated when they're sick. So we need to give her some fluids. But what we'll do is give her about 15 or 20 mils now. We'll just start to rehydrate her.
That nasty gash on Fluky's flipper is certainly hard to ignore, and really the best thing I can do right now is clean it up and get rid of any bacteria that are present.
Stings a bit.
Yeah. All right. Look, mate, I'm pretty happy that we've now stabilised her. So what she really needs now is to recover. So I'm thinking we take her over to Manly. And I know just the place for her.
You know, you do?
Yeah.
Good. I might say goodbye to both of you at this point, and good luck.
The reality is that Fluky's battles are only just beginning. She's still incredibly vulnerable, and my hope is that what I've done today proves to be enough.
Good boy. Oh, sweetie, sit down. Good boy.
At SASH, 9-month-old Labrador Charlie needs an urgent CT scan on his legs.
Charlie's problem in his elbow joint is going to limit his ability to be a normal, happy pup because they love to run around the park, they love to chase the kids, chase the ball. So poor old Charlie unfortunately can't do that at the moment because his elbow hurts too much. So our job is to try and fix that.
It's feared the puppy is suffering from a form of elbow dysplasia.
Over time, Charlie's going to get arthritis, and unfortunately, arthritis is a very debilitating condition in dogs like it is in people. So we want to try and treat that now so that we can help prevent the progression of arthritis in this joint. Now that looks good, girls. Perfectly positioned. It's great. So what we're looking at in Charlie's elbow is to see if there's any small little bits of bone or cartilage that haven't developed properly. Oh yeah. All right. This little fragment here off the end of the bone is a little fracture that he's got in his elbow joint, and that's his good elbow, that's his left elbow. And his bad elbow has got an even bigger fragment. A little piece of bone has fractured away there, so it's like a little loose pebble that's going to hurt as he walks on it. So he's got it on both sides, unfortunately. I think Charlie's probably been tolerating this pretty well, actually. I'm surprised that he hasn't been showing more signs. So the next step is to do an operation with an arthroscope, which is a very small camera that we put inside the joint to have a look at the damaged structures in the joint, and then we put some little forceps in there to remove those loose pieces of bone and try and relieve some of the discomfort that he's got. Poor old Charlie.
prepared.
All prepared.
Amazing. So this is the new home.
Chris has found the ideal place for Flukey's much-needed rehabilitation.
Good luck, little girl. You're gonna feel better pretty soon.
The hawksbill turtle is suffering from floater syndrome and is about to begin the long road to recovery at the Manly Sea Life Sanctuary.
Flukey's doing it pretty hard at the moment. She has an uphill battle. The next couple of days will be critical for her. So what we hope is that Flukey will start showing us a few positive signs to show that she's on the way to recovery. So we'll do our best and whatever we can to help her out.
So that's freshwater at the moment, isn't it?
Yes. Freshwater is one of the first things we do when we do have rescue turtles. It does take care of all that barnacle growth on her shell and on her flippers and on her head. So hopefully they will fall off, and that's in addition to rehydrating her as well.
It seems strange to put Flukey into a tank that has such a low level of water. The fact is, when she's weak like this, having her in deep water means she could actually drown. By having that little island in the middle means she can actually dock herself on there and rest up. And rest is what she needs. It's actually really encouraging to see her move around like that.
Good sign she's able to raise her head and take a breath by herself. So we'll see how Flukey goes, but we'll give her the best care possible and hopefully she makes a full recovery and time will tell.
The fact is, right now, Flukey's health is balanced on a knife edge. She's got some weight to put back on. She's obviously got to get rid of that air that's inside her body cavity. But really, it's about her building up her strength and her immune system. If she can do that, we're a much better chance of getting that recovery we need here.
You good to go, girls? So both elbows, please.
At SASH, Labrador puppy Charlie is about to undergo incredibly delicate surgery on both his elbows.
So the condition that he's got is called elbow dysplasia, and the particular thing he's got is called fragmented chiroid process, which is where a small piece of bone inside the elbow joint breaks away.
It's hoped the surgery will help slow down the onset of arthritis.
So what we're going to do with Charlie today is a procedure called an arthroscopy, which is where we put a high-resolution camera attached to a scope into his joint. The scope is tiny, it's about 1.4 millimetres in diameter, so it allows us to get into his joint without making a big hole, and it allows us to magnify the surface of his joints. We can look at it in a great deal more detail than we could if we actually opened the whole joint up. So this is his good elbow, relatively good elbow. We'll have a look inside here. So I'll just put a needle into the back of his joint first. Make a little incision. Slide our camera into his joint. Righto, and have a look around, see what we can see. In the joint, there he is, hello. We get the point of the needle and we just lift this up. Whoa, look at that. There you go, that's the broken piece of bone that we're just lifting up there now. And so that's the fracture. Can you imagine trying to walk around on that? That's gonna hurt. Put on Charlie.
Steve now has the difficult task of extracting the loose bone fragment.
There's my grasping forceps that I'm going to use to grab this thing. Now, I've got a lot of room to move in here. This is a pretty tight joint. Come on, baby, come on, baby. There you go. So that's it. There we go, that's most of it there. And that joint looks a lot clearer now. So what we do now is we just scrape back the edges a little bit to make them healthy, and that allows new cartilage to seal over the damaged area. All right, good. The closure is pretty easy, it's 2 stitches, that's it. All right, so elbow 1 is done. So let's get on to the second side, which is his worst side. So it'll be interesting to see how this compares to that first one.
Hey Frankie, things are happening now. We're going to get you into theatre, get this all sorted out.
At SASH, Little Dachshund Frankie has a severe slipped disc and needs urgent spinal surgery.
Unfortunately, Frankie is prone to an early degeneration of her discs. The material of the disc becomes thick and calcified, and in this case has popped out of its capsule and is now slipped and squashing her spinal cord.
we're going to try and remove that disc material and try and relieve the pressure on her spinal cord. Now, it's not a straightforward surgery, but it is Frankie's only chance at being able to walk normally again.
Specialist surgeon Sue Kwan is performing the delicate procedure.
All right, incision.
It's always a little nerve-wracking watching a spinal surgery from outside because I know how small the area is that they're working in, and one wrong move could be catastrophic.
Just dissecting the muscle of the vertebra. There we go. There's the view. So, 13, 12, 11. Count 3 times, cut once. Do not want to cut at the wrong spot.
1.
It's just piece by piece.
Sue has to be really careful here because if she drills too far, she could drill right into the spinal cord, permanently paralysing Frankie.
Whoa, look at that. Got whole chunks of this material.
Now to the delicate task of carefully scooping out the disc material that's squashing Frankie's spinal cord and causing her so much distress.
All right, that's pretty good. Sitting better now. There's no way this dog could not feel better after this. So it's gone really well, all things considered. We removed a large amount of disc material. Spinal cord appears decompressed. There's nothing pressing up against it. There's no major hemorrhage. So we're going to close up, and then it's 6 weeks of cage rest and hope for the best.
After spinal surgery, there's a lot of inflammation and animals can actually get worse before we see any sign of improvement. She's going to be in a lot of pain, but thankfully we've given her an epidural and some pretty strong pain relief, and I just hope that when she wakes up, we're going to see some progress.
Good, Frankie. Good girl.
Alrighty, Charlie, let's get this joint sorted out for you.
Also at SASH, Dr. Steve Fernside is halfway through surgery on 9-month-old Labrador Charlie.
Oh, straight away, you can see that's where the bone has been actually damaged. You can see again that crack through the cartilage and bone in his joint. So no wonder this joint is sore. So I'm just gently lifting that up, and that should be all solid. Shouldn't be able to get my probe in there at all. The concern that I have for Charlie is that, you know, he's got, both his elbows have got problems in them, and this is going to lead to arthritis. Now, we're going to help by removing these painful loose fragments in his joint, but we're not going to cure his disease, unfortunately. That's a big chunk of bone. So I can grab it there. The trouble is, he's just pretty jammed in there.
Retrieving the piece of bone is an incredibly delicate process.
When you're trying to get a 6 or 7 millimetre fragment out of a 3 or 4 millimetre hole, then the maths just doesn't add up. So we're going to have to probably get this guy out in a few little pieces, I think. There we go. There's a bit for you.
Bit by bit, Steve is slowly removing the offending chunk of bone.
Gotcha. There you go. That's what I'm after. Look at that, baby. So that's that big chunk of bone we've been trying to get out. That joint looks pretty clear now, which is great. I'm hoping that makes his joint feel better, and in the long term, helps him with his arthritis too. All right, guys, we're done. The surgery was challenging in parts because particularly on that right side, that bone fragment was quite big. So hopefully we've removed those irritating loose fragments from Charlie's joint, so he can now run around the park and do all the things that young dogs like to do.
Charlie will need to spend the next few days at SASH recovering.
He's a good boy.
sweetheart. Hi. Hey, you're a good girl. How you doing? How you going? Hey?
Frankie has now woken up after the marathon surgery earlier today on her back.
Hello. You feel better? You're talking a lot. I've got a visitor for you. Okay? Wanna come see who's here?
Owner Sean is desperate to see how his precious little girl is recovering.
Hey, you want to see Dad? Hi.
Hey.
Look who's here.
Hey, little cow.
Hey.
No.
I'm just a bit sleepy on her pain relief. You're talking to Daddy. Hey, what you saying?
Oh. Don't usually hear those sorts of noises, do we? Hey?
It's only been 12 hours and Frankie is already up and about after major spinal surgery. It always amazes me how resilient animals like this are. She wants to get better and she's going to do everything she can to do just that. So this is a padded sling. I pop that under her belly. So she wants to walk, which is great. But I'm not going to let her go to full steam yet because we want to make sure she takes it slow. Frankie, come to Dad.
Thank you.
Come on, honey. So that's a really great sign. I mean, it is early days and we don't want to get ahead of ourselves. So we're just going to take it one day at a time.
Okay, great.
Okay. All right, sweetheart. I know you don't want to, but I'm going to take you back to bed. Okay?
Thank you.
You say bye to Daddy and you see him later.
You'll be okay. Okay? Come see you tomorrow.
Come on with me. Girl. Stop talking.
All right, Charlie, how are we going? Hello, mate.
At Sash, Chocolate Labrador Charlie is making amazing progress after surgery on both his elbows.
Let's have a look at you. How are those legs? All right? Bit of a look here. Stitches look good.
Dr. Steve Fernside is giving the pup one last check over before it's home time.
All right, Charlie. How about we give you a test run? Come on, mate. Let's have a look at you. Come on. Good boy. Good boy, come on, and back again. So big day's come for Charlie. He's ready to go home. His elbows look good. He's got good movement in them. They seem comfortable. So we're always worried when we operate on both sides that they can be pretty sore for a few days, but Charlie seems to have bounced back really well, so I'm very pleased. You all right? Ready to go? I reckon Harry's going to be pleased to see you. What do you reckon?
Out in reception, Charlie's family can't wait to see him.
At home it's been really, really quiet, so Harry's struggled for the last couple of days.
I miss Charlie.
You do, don't you? Really missed him. Best mate.
Charlie will be very excited.
Good boy. Pulling like a steam train, mate.
Can you see him?
Charlie! Whoa!
Hello, beautiful. Hello, gorgeous.
I think someone's happy to see you, Harry. What do you reckon?
Hello, gorgeous.
There you go, Charlie.
How have you been?
Sit down.
Look at your legs.
What is it?
So, Harry, now, Charlie told me that he was a bit worried because he thought that people might laugh at him with his funny haircut. So can you look after him nicely and be nice to him so that nobody laughs at him because he was a bit worried about his haircut? All right? But all his hair will grow back and then you won't know.
I missed you, Charlie.
Charlie's Harry's first dog, so it's lovely to reunite them and help him out, you know, helping his old mate out and getting him back so that they can run around the park and do all the things that kids and dogs love to do. So it's very important to get that bond back and working together again. You give us a call if you've got any worries.
Yeah.
I think he should be pretty well back to his normal self. So your biggest challenge should be keeping him quiet.
He looks really happy and really good considering everything he's gone through. I think Harry's going to be a lot more settled now. Now he's got his buddy back.
Come on, Mum.
Thanks, Harry.
go? Let's go. You ready? Hurry, quick. Charlie's going to run away without us.
And a few days later, it's also time for spinal patient Frankie to go home.
Hi! It's your big day! Hello! Oh my goodness! Look at you! Hey! Look at you!
Owner Sean is eager to see his little girl.
No doubt she'll be wanting to jump off 6-foot tall buildings as soon as we get home, and it's just a matter of making sure that we look after her as best we can.
Look who's there! Hey!
Hey, little cow. Hello. Hello. How's she going?
Looks pretty good, doesn't she?
Yeah.
You gotta see her walk. Yeah, she's got her spirit back.
Yeah. Hey.
That's for sure.
Hey.
Frankie, let's show Dad what you can do. You ready? Slowly. Slowly, slowly. Slowly, slowly.
Frankie. Frankie's just as pumped as what she usually is when she sees us. The tail's going 1,000,000 miles an hour. She looked great. She's really good. Ready to go home, Frank? Yeah? I reckon the tail says yes.
So she talks at the tail, that's for sure.
Cow on there, little cow.
Well, we'll miss you. We'll miss you around here. You're full of personality, that's for sure. You call us if you need anything.
Excellent.
Okay?
Thanks for your help, Lisa.
No problem.
Come on, Kara.
Frankie's a really lucky dog, but I think a big part of it is that Sean's such a great owner. I think the combination of the two of them makes Frankie destined to recover.
Hey, good cow.
I arrived at mealtime.
Hi, Dr. Chris.
How are you?
definitely have. Welcome back. Well, thank you. How are you?
Look at her.
A few weeks later, Chris has returned to the Manly Sea Life Sanctuary to check up on Fluky.
She's looking much, much better. She's sorted out all the buoyancy issues, so she's swimming very well.
And also, those barnacles are gone.
Yep, the freshwater bath has taken care of those, and that's made her more active and way more healthy.
The hawksbill turtle was brought to the Bondi clinic after being found suffering from floater syndrome and with a nasty swelling of the neck.
This ballooning out of her skin here, that's not something you normally see. So whether she's underweight and the skin's then become loose and doubled up around her neck.
So we've identified what our issue was. It comes down to something very small like that.
What is that?
So this is a little piece of latex or rubber. It's almost like part of a balloon.
Yeah.
So this was embedded in the top of Fluke's neck.
Where'd she have that swelling?
Exactly.
Wow. It doesn't seem like much, but when that little piece of rubber lodged in the skin folds around Fluky's neck, it caused a lot of swelling, and that swelling meant that she couldn't eat, and she found it hard to breathe. Every day would have been a struggle.
And
Just shows you how tough it is for these guys out there.
Most definitely, and these types of things in the ocean are a huge risk to all of our marine life.
Obviously there's one place that this piece of rubber comes from, and it's from us. It's from our waste. And it's just been a one-way trip for Fluky to being quite sick and quite unwell.
Fluky's recovery still has a long way to go. She needs to regain her condition to have any hope of being released back into the wild.
Well, look, keep up the great work.
Thank you, Dr. Chris. Thank you for visiting us again.
No worries, Fluky. I'll see you soon, girl.
Come on, sweetheart. Come on. Come on, cheeky. He's fast. Great. So for the shortest person in the room, he's picked the highest spot.
Come on.
At Sash, Lisa's next patient isn't too keen on a visit to the vet.
Hey, you're a cheeky little one. You're a very cheeky little one.
Cassie from reception has brought out a stray budgie that was found by a member of the public. The first thing I have to do is check him out. I've got to make sure that he's not injured, and if he's all okay, then we've got to focus on finding his owner.
Hey, buddy. Ooh. Come on. Oh, he's pretty tame.
As soon as we open the box, this little budgie starts flying around the room, and he goes from picture frame to blinds to my head. We cannot catch this budgie no matter how hard we're trying.
Good boy.
All right, Cassie, you're the bird whisperer. Come on.
Okay, right.
Luckily, Cassie has the magic touch. She's caught the budgie, and I can finally examine him. Just looking for any wounds or anything around. And he feels like he's in really good condition. Ouch! Hey, stop. Ouch! I finally managed to give him a full checkup, and with his ability to fly and bite my hand, his energy levels, I think that this little guy is just fine. No. He's
Nothing
not
found.
Okay. All right, buddy. A busy vet hospital is no place for a little guy like this to be. So luckily Cassie has decided to take him home. She's got a few other birds that she'll keep him separate from, but she's experienced and hopefully she'll be able to track the owners down. Hey, sweetheart, here's your new home. Hey, might be happier to go in here.
Whoa, straight in.
Go. Hey, mister. You're a bit of a handful. I'm exhausted. Next time someone brings me a stray, I think I'll have a cup of coffee first. And this is just the start of the day. Yes.
And 4 months later, Chris is in Coffs Harbour to see a very special patient.
Hello guys, how are you? G'day Marina. Did you ever think this day would come?
I did have my doubts initially. She was in quite a bad way when you first brought her to us.
Fluky would have to be one of the most extraordinary patients I've ever had the pleasure of treating. She was found floating off the coast of Sydney, lost and alone, and really with no chance of survival. She was rescued by some fishermen who brought her into shore, and from there Tim Faulkner brought her to me, and then after that she's been cared for by Manly Sea Life. Hey Fluky. Hey? This is a day that we almost didn't dream would ever happen. When she first came into me all those months ago, she was in terrible shape, desperately underweight, with infections all over her body and with a piece of rubber wrapped around her neck.
All her wounds are closed over. She's gained quite a nice weight and she's passed all of her pre-release checks. She's as good as new now, so it's all up to her. The team at Manly Sea Life Sanctuary are very, very, very happy to be able to release Fluky back home, where we hope that she will flourish and survive and grow into an adult that can then reproduce and do her bit for the species.
I'm sure she's got salt air in her nostrils.
I think so too.
Raring to go.
I think so.
So, should we do it?
Let's do it.
We've chosen Coffs Harbour for a couple of reasons. First of all, the conditions are perfect. The water temperature is ideal at 25 degrees and the currents are really favourable. There's no reason why, once we get Fluky into that water, she won't take off and hopefully go back to what should be a long and happy life out there in the wild.
Let's go.
We get you home to see the family for dinner. You're a bit late. Come on, girl. It's been a while since you saw the big blue. Try to hold it for you, Emma.
I'm trying. Okay, let's go.
Go, guys.
Good luck, Luke.
Sometimes turtles will hang around, they'll bob their head up, they'll try to get their bearings. For Fluky, there's none of that.
Good luck.
Yeah. Shadow, go.
Beautiful. Straight away under the wave.
Like a rocket. That is awesome. Well done.
Good result.
Incredible work.
Incredible.
That speed.
Amazing. She was ready to go.
Up until this point, Marina's really tried to put on quite a brave face, but seeing her girl disappear into the waves like that, all of a sudden, it's too much.
Giving her back to her home, to where she belongs.
Yeah.
And there's no greater gift than being able to do that, especially considering how sick she was.
Yeah.
So
Well
fantastic.
Done, well done.
Oh, team effort.
Around these parts, Bridgette and Paula, the twinnies, are renowned for their passion and dedication for rescuing pelicans. Now today they've called me in to help out one that has a mysterious condition that has even them stumped.
Chris is on the Gold Coast to meet a couple of familiar old friends who are dedicated to the care and rehabilitation of seabirds.
Hey twinnies.
Hello.
How are you?
Good.
Good to see you.
Yes, good to see you too.
So this is the girl, you nearly got a kiss as well.
Yes.
This is the girl you told me about?
Yes, yes we did.
Does she have a name?
Yes, we've named her Flipper.
Okay.
And you'll know why.
Just look straight down there, yeah.
Yes.
Wow.
There's no doubt about it. Right now, Flipper is in a bad way. She's just missing all that webbing, and really that foot of hers just looks so fragile now.
How's her general condition?
She's in good body condition.
Flipper was found by a member of the public who came across the stricken bird while out fishing.
When we saw Flipper for the first time and looked at her foot, we've never seen nothing like it before, so we couldn't really tell what's really happened to her.
And you can see the problem straight away. She's missing really that whole section there.
Yes.
And the fact it's not there worries me, but to be honest, what worries me the most is that. This black colour really says that we've got dead tissue there.
A black discoloration to any part of the body essentially means the blood supply is gone and that tissue is dead.
You know, already I've got big concerns that we might even lose what's remaining of these two toes.
Yeah.
Pretty brave, though, isn't she? She hasn't really made any noise or anything.
Little 6-month-old Tonkinese kitten Luna has been rushed into the Bondi Referral Hospital sash after a nasty fall at home.
See, her paw is a little bit twisted, isn't it? Poor little thing.
The tiny kitten can't put any weight on her front right leg.
Luna is beautiful and very, very friendly, very, very playful. We've only had her for about 3 months, but she runs around like crazy. So we think maybe she jumped off the bunk bed and fell badly. It's okay. We're going to go and get you looked at, hey? Here we are.
Hello, I'm Lisa. I'm one
Hi.
of the emergency vets.
Hi.
This must be little Luna.
It is Luna.
All right, come through. When I first see Luna sitting on Adam's lap, the first thing I can think of is she is so cute. She's a tiny little kitten, and I'm worried that she's done something pretty serious. Okay. So take a seat, just over here. All right, now what's happened with Luna?
She has fallen off something at a high level and she has damaged her right leg. Front
leg?
Yeah.
Is she putting weight on it at all?
No.
No.
As you can see, that one, she moves it. This
Yeah.
one, she doesn't move at all.
How high was the height that she fell off?
Probably about 2 meters.
2 meters.
Yeah.
Was it a balcony or?
No, just a bunk bed.
And at the time, did she sort of just start screaming straight away, or did she?
No,
run
she
off,
just
or?
ran for cover. We just sort of limped for cover.
Yeah. And any issues with her consciousness, her breathing?
No.
All right. I would like to see her walking around the room. Often when cats are in pain, they might just sit in a corner and not move.
No,
so we'll just see what she does.
She'll try.
It's really important that I see how Luna moves. Hey, Luna. Luna. And the first thing I notice is that she seems really uncomfortable.
Yeah, you see, she must be ill because she'll chase this pen like crazy if she was well.
Yeah, well, she knows that it's going to hurt to do it, so she's just sitting there guarding herself. It's a real concern that Luna doesn't want to put any weight on that front right leg. What I need to work out is, has she damaged the nerve, the muscles, or the bone? Because she's a 6-month-old kitten. She should be running around and playing, and all she's doing is sitting still with her leg rotated. Something is seriously wrong.
Let's pop her up on the table.
Up on the table, okay.
All right, little girl. I'm just gonna have a look at the rest of you first.
I'm really worried about Luna. I need to have a really good look at her.
There you go. Nice and gentle.
I need to examine her from head to toe because she's fallen from a height and her leg may not be the only problem.
Let's have a look, because you're just a baby. And she doesn't seem to have any issues with her jaw, which is good. I mean, that can sometimes happen when they fall from a height. They can fracture their jaw. She's breathing normally, which is good. The lungs sound nice and clear. Hey, sweet pea.
Thank goodness for Luna. Her checkup is all clear. She's one lucky cat. The next thing I need to do is look at Luna's leg.
She's a brave girl, whatever she's done. And she does have the ability to pull the leg away.
Yeah.
I guess that would happen if there is a nerve injury or if there's a broken bone, for example. I'm just going to have a gentle feel over here. I can definitely feel some crunching here.
Yeah, crunching's not a good sound.
Yeah, no.
Yeah.
Something feels really unstable in that shoulder.
Okay.
I'm really worried she's got a broken leg. Even though I'm feeling Luna's leg quite gently, as soon as I get to the upper part of the limb, I can feel some crunching and instability, and to me, that feels like a broken bone. Now that has got to hurt. First things first is we need to take some x-rays.
Sure.
So we need to give her some sedation or an anaesthetic and take some really good pictures so we can see exactly what she's done. There's a good chance that if the break is severe enough that she's going to need surgery.
Oh, okay.
So you're committed to go ahead if that's what we think she needs?
Of course.
Okay.
I was hoping that she would just have a sprain of some kind, so you don't ever want to think of people or anything breaking their bones. It's not good. But the nice thing is she's in capable hands.
This toe is not in bad shape,
No.
but you can just see where that webbing ends there.
Yes.
It's just hanging on for its life.
Chris has been called to help a pelican in distress on the Gold Coast.
These ones here, and even this one up here, isn't looking great.
I'm looking at that dead tissue and thinking, how am I going to treat it? But before I work out that, I have to understand what's actually caused it.
The way it looks, I would say either she's been bitten by something and she's got an infection after that,
Yes.
whether that's a shark, that's a possibility, or whether she's stood on something and got a little electric shock, because that does look like an electrical burn.
Yeah, it does, yes.
There was no fishing line on her, was there?
No, there's no fishing line, but you can see the old scars. Yeah.
All sorts of different possibilities as to what could have caused this injury are swirling around my head when all of a sudden my finger runs across a little groove on the leg.
I mean, that is quite deep, and that goes right around. See, that's interesting, because if she's had fishing line around there, that acts like a tourniquet, as you know, and so it starts to affect the blood supply to the foot below it.
Yes.
I actually think the blood supply has been so badly affected to the lower part of the foot, and especially the webbing and the end of the toes, that they're no longer getting blood. And when tissue no longer gets blood, it starts to die off.
It's like pieces of this jigsaw puzzle are falling into place before my very eyes. This fishing line wrapped around the leg essentially acted like a dam on a river. It blocked off almost all the flow. So further downstream in the toes or the webbing simply missed out. It went dry and therefore the tissue has died off.
So that's important because what it tells us, and I think this is good news, is that we don't have a nasty infection raging that's trying to work its way up the leg. We've kind of identified the reason why this has happened.
Yes.
And now we also know that the blood supply should be returning back to that foot.
Yes. Yes.
The key now is to check whether that fishing line being wrapped around the leg for so long has caused a permanent problem. By simply pricking the webbing with a needle, we'll know straight away if that blood supply is present.
Oh, yeah, good.
Wow.
That's a good sign,
Okay.
isn't it?
Yeah, it is. So we've got blood supply there,
Yes.
and that's in the webbing. So that says to me that webbing's probably going to survive. Now I know this foot is viable, it's important to make sure we don't have any further infection or any further damage to this tissue. There's not much left, so we have to make sure we preserve what is there.
Go, darling.
Come on, darling. Oh, oops. You just didn't want to come out. What's the matter?
At SASH, Lisa has called in specialist surgeon Dr. Andrew
This one, huh?
to confirm Luna's diagnosis.
There's definitely something broken. We better get some x-rays and find out what exactly the fracture is. So I've had a little bit of a feel and there's a bit of crunchiness going on in there. So we've got to see exactly what she's done, but I'm a bit fearful.
All right, honey. It'll be a little bit cold.
Luna needs to be anaesthetised so she won't feel pain when her injured leg is positioned for the x-rays.
Dim the lights.
All right.
All right. Let's see what she's done. Ouch.
That's where the crunching came from. So she's got that fracture right in the middle of that humerus or arm bone.
She's just snapped it in half.
Yeah. She must have landed on it and just gone.
Yeah, well, she's so tiny. She's got tiny little bones. And as the x-ray comes up, we can see straight away that she has got a massive break right through the middle of her humerus. Now, that's the bone at the top of her leg, and that will cause her a lot of pain and explain exactly why she's not putting any weight on it at all.
She's done a good job on herself there.
Oh, that is a big break.
Right, well, we're definitely going to have to do some surgery. That's not going to heal itself.
No, absolutely.
We can't put a cast on that, so.
No, not a chance.
Because Luna is already anaesthetised, she will go straight into surgery, which will give her the best chance of a quick recovery.
It's going to be really fiddly because it's little bone, lots of muscles, big nerves, and I've got to work in and around all of that, so it's going to be pretty intricate. And she's going to need her 9 lives. All right, we'll see how we go. Right, Luna. Well, let's start. I'm going to make a nice long incision to get up this whole bone. There's a radial nerve, which we want to avoid.
It's very bruised.
It is bruised. There's a fracture sign just there. We're just getting down that we actually see where that break is now, so we'll just have to manipulate these bones a little bit, stretch them out. What tends to happen after you get a fracture is the muscles sort of contract and the fracture ends override. So we're going to have to stretch it back out, temporarily clamp it in that position, and then put the plate on. All right, I'll just get a few wires around that now. All right, that's good.
Andrew can now start to screw on a supporting plate.
Great, that's one. Now we'll just do some drilling now and we'll see how we go. That's good. Screw, and I'll just try and get one up here above. The real risk here is these bones are really fine and actually quite brittle. And if we're not very careful, you can actually shatter them. And if that happens, then we're in a real deal of trouble. So we're just going to place this last screw. And we've just got to close the muscle in the skin and we're done. I'm really happy with how that fracture came together. There's a little bit of a fiddle just because the bones are so small and so fine. You put your finger just there. All right. So we'll go and take some x-rays to just make sure we've got all the implants in the right spot. Nice. You can see sort of that's where the fracture was. So we've got 1, 2, 3 screws below that fracture site, and we've got 3 nice screws above it. Got to be happy with that.
Happy to wake her up?
Yeah, sure. Look, it's probably going to take her a good 6 or 8 weeks to heal fully, but she'll feel like she's fixed almost straight away because that plate's really solid and it'll feel like a new leg. We'll just get her into her recovery bed now and we'll see how she's going tomorrow.
Before we can fix this foot, the next thing I want to do is just see how she's supporting her weight. Because that's going to tell me how painful this foot is.
Yes. On the Gold Coast, Chris is assessing the severity of Flipper the Pelican's injuries.
She's taking, I would say, about 80% of her weight on her left leg, and that's going to cause problems in that leg too.
Yeah, will.
Flipper lost most of the webbing and toes on her right foot after fishing line cut off blood supply further up the leg.
First, let's clean this foot up.
Yes.
And then, while we're doing that, I'll try to work out a way to actually make this foot a lot more comfortable and a lot more functional.
You'll do it.
Thank you. I hope so.
Chris now needs to carefully clean up the infected area.
I don't really want to be too vigorous in there because we've already got very raw tissue that if I expose it, it increases the risk of it getting a secondary infection.
Oh, okay. Well, Chris has been gentle, isn't he, huh? Yeah.
Okay, that's looking a lot better now. So
Yes.
that antiseptic will stop the bacteria from invading into those open wounds.
Yes.
That's a start. What's really going to help is some antibiotics.
The antibiotics will treat any infection or disease caused by bacteria from the injured foot.
We'll just do a little sting in this.
All right, so between the antibiotic and the antiseptic, I'm confident now that bacteria invading into this wound isn't going to be such a big deal.
Yes, okay.
All right.
That's good to hear. Yes.
But I still think the biggest issue we've got is this pressure problem. She's just not comfortable enough or confident enough to put anything like what she needs to in terms of weight on this bad foot.
Yeah.
What really worries me about Flipper right now is the fact that she's a big bird. She weighs 6 kilograms and all that weight going through one foot. Any bird is susceptible to a foot problem called bumblefoot. It's caused by too much pressure going through the feet and infections being the result of it. I think I might need to go for a drive.
Okay. Oh, wow, you're already on top of it.
I wouldn't say that, but I've got an idea about what I could use.
Okay. I'm not sure what Chris is up to, but he's on top of things already. He thinks so quick, he's just amazing. We know that Chris can fix Flipper.
I made a bit of a habit of coming up with interesting solutions for the twinnies, and today might be no different.
Hey Tim,
yeah, mate.
We just got a tiger snake handed in at front desk.
Is there now?
Yeah.
Really? Where from?
I'm not sure, a guy just handed it in.
At the Australian Reptile Park, it's snake training day for rookie keeper Zach.
Do you know what size it is?
No, no idea. I just got the radio call then.
But an urgent call from the front desk has put training on hold.
Hello, mate.
There you
How are you? Tim.
Tony.
Nice to meet you.
What's that?
What do you got?
Tiger snake.
Where from?
Found it in the laundry. The daughter went out to get some clothes out of the washing machine and nearly bit her, apparently.
Jeez. People know that we're the sole supplier of snake venom for the production of anti-venom in Australia. And if snakes are caught from urban areas where you can't release a tiger snake, we can include them in the venom program. Well, I'd forgive you for thinking it's a tiger because it looks almost exactly the same. But it's actually a brown tree snake. Yeah, but they do have the stripes, mildly venomous. You wouldn't want to get bitten, hence the reason I put that there. But yeah, long.
Gorgeous little fella.
Long, and a real good size. You don't often see adults that big.
We get calls like that all the time, mainly harmless snakes like your swamp snakes or your brown trees, stuff like that, but every now and then you get something nice like a tiger or a death adder.
Well, not suitable for the venom program because it's a brown tree, but nice snake all the same. Oh, he looks good. He's going to have a bit of a spit. I'm going to take him in. Nice to meet you. You happy for us to let him go?
Certainly am.
Yep, good on you, mate.
Have a good one.
Okay, see you later. Tony's made a really understandable mistake. He's got 4 kids. He's found a snake in his laundry that does look like a tiger snake, but it's a brown tree snake, mildly venomous, essentially harmless.
The park is surrounded by bush, the perfect habitat to release the wandering brown tree snake.
She's ready to go. Have you held a brown tree before, a wild one?
No, man, just the one we got at the park.
No? Okay. Well, he's a boy. He's got his hemipenes out. Sit down. Okay, take him, mate. Now, I can't see any ticks, but I know it's a little unorthodox, but just gently pin him with that, just like you would any other, mate. That's it, nice and soft. That's a fella. Well done. Okay, we got any ticks?
No, he's looking pretty clean.
I like, mate, with the wild ones, if they've got ticks on them, just to take them off. I mean, the tick will fall off in good time, but we can give him a helping hand. Do you want to pop him down? Just let him go over here. Well done. Off he goes.
There we go, he's got a bit of cover now, so he's safe.
Off.
You've been a good girl. You're a very good girl.
Okay, Twinnies, been shopping.
That was quick.
It was. So, it looks like I bought a yoga mat, but it's not.
Chris has come up with a creative solution for injured pelican Flipper.
You've actually given me the idea for this. We're going to give Flipper, or Flip, her own flip-flop. Because what we need here, it's cushioning, sure, but also we need protection for these toes that are still there.
Yes, that's right.
And we need a way to make her more comfortable so that she will actually start to put weight on this foot. I'm thinking, what's the most basic form of footwear that offers some sort of comfort or even support? And suddenly, it hits me. It's thongs or flip-flops. So, what I want to do is lay this out. Then I want her foot,
The good one or the bad one?
the bad one.
Okay.
I want her foot right there. Make sure she's nice and comfortable. Okay. So now, go right around it.
First of all, Chris needs to make a protective base for Flipper's injured foot.
So that is a good starting point.
Then, with the help of a reverse template of the pelican's good foot, he can start to put together his master plan.
We love Chris's idea of the flip-flop and for Flipper's foot, and we think it is going to work.
Pretty sure I haven't done this much arts and crafts since kindergarten. Right, so that's Flip's new foot.
Yes.
You can see where her existing foot is going to go in. And then, once those little toes are in there, we need to now secure them across the top.
Okay.
And the way we're going to do that is with this.
Good old Velcro.
Good old Velcro.
As Flipper waits patiently, Chris is attaching the Velcro that will help keep the shoe in place, along with some cushioning.
Okay.
Yes.
I think I'm ready for our patient.
Okay. Good girl.
All right. So tell me, what are you doing at the moment?
So handling adders, handling and milking tiger snakes, and I've just started with king browns, just started handling.
Okay. At the Australian Reptile Park, Tim has organised some advanced training for rookie keeper Zach.
Ever since I can remember, I've wanted to be a reptile keeper, and there's no better place to do it than here at the park. I've been coming here every weekend since I was a little tacker, and knowing that I'm saving lives in the process is an incredible feeling.
Okay, let's get Big Kev, and I want to see you milk him, and just have a look at your technique and see how you're going. Tiger snakes have the 4th strongest venom of any snake on earth, but they're puppy dogs. They're quiet, timid, short, easy to work with, and they're a good snake to start on. So we'll get a vial. You got your hook?
Yep. Beautiful.
There you go. Go for it, mate. That's good, mate. Eyes on the head at all times. Zach's removed the tiger, handling it well. He's got good action in his wrist that stops that snake from coming back up. Nice snake, big tiger.
Yeah, he's a good size one.
And your action's there good, mate. He's trying to come up a bit. That little turn's nice. Handling a snake is one thing. Pinning and restraint is another. That's when you're going to get bitten.
Straighten out for me, buddy.
That's it, take your time.
Oh, missed him.
Oh. That's it. Nice and soft, not too much pressure. Walk those hands up. Zach's doing well. He's missed the pin a little bit, but he takes his time and moves it up. It needs to be a smooth process. Well done. Snake's head the right way, restrain and present to the vial. Okay, nice and easy. Remember, we want a nice chew, not just a bite. Okay.
1, 2, 3.
Whoa, that's what we wanted. 2 fangs.
Yep, we got both fangs in.
Nice. Zach looks good. Cool as a cucumber. He's practiced this. This snake's Big Kev. He's the biggest tiger. If you were going to be rattled, it'd be with him. Now, what you want to do is get him to need a bit of a chew. So just bring him back down a little. Just fix your hand up that way a bit. That's it. And see if you'll have a chew. There we go. Good stuff. Okay, that's nice, mate. We've got a couple of drops there. Enough to knock you and I both over.
Yeah.
Okay, so you want to sit that vial down and release. That's it. Gently off. Remember, the release is as important as the capture.
3, 2, 1.
Well done, mate. Back in.
Oh, in you go, buddy.
Okay, that's Big Kev done. So what do you think about popping it up to the next step?
What's the next step?
Well, that's a good question, mate, but I reckon you're ready.
I feel like he did really well with Big Kev. The boss seemed happy with it, but I feel like he's coming back with something a bit different, so it's going to be interesting.
You stand here and sweat for a minute. I'm going to bring someone in.
Okay. I think I'm ready for our patient.
Okay.
I feel like a podiatrist.
At the Twinnies Rescue Centre, Chris is ready to try out his carefully crafted shoe on Flipper the crippled pelican.
Oh, little sweetheart.
This is really make or break for Flipper. This has to work, otherwise she could be facing a lifetime of problems. Let's hope it fits, huh?
Yes. Yeah, it looks like it's perfect.
So just like the straps on a pair of sandals.
Yes.
We'll start to put these across. So we're happy that it's sitting in there nicely.
Yes. Yes.
Nothing's rubbing, everything's been cushioned. Okay, it's a pretty good fit.
Yes.
I've got to say, I'm actually pretty happy with that. It is a lightweight fix for a heavy bird problem. So it's just going to take some getting used to for her. So once she feels like this is how it's meant to be, and it becomes her new normal,
yes,
then she'll start taking the weight off this left leg,
yes,
and shifting it onto the right.
Yes.
And we can start doing that by lifting up the left leg.
Yeah.
You see now, all that weight is through her right leg.
Yeah.
Really, a little bit of physio like that from the Twinnies, and in the next few days, we should really start to see Flipper starting to walk more normally and spread that weight more evenly. And that would be a perfect result. Put her on the ground. Let's have a look. I'll move this away.
Perfect.
What do you reckon? What do you think?
Oh my God. See? See?
Your pair of shoes. Yeah.
Mate, you're happy, miss?
A little flap of approval from the Flipper.
No, look, she's walking perfectly.
She just wants to show off the new shoes to the neighbours.
I know that she's got it even on there. Perfect fit.
And she's standing a bit more square, isn't she?
Yeah, oh, what a sweetheart. Well,
Amazing.
you've done another good job. This challenge, again, what Chris has done, he's an amazing vet. And that's why we always keep our challenges for Chris.
All right, we'll leave her to rest.
Yes. Here you go, darling. Look at you.
I'll be honest, when I got the call from the Twinnies about Flipper, I had serious concerns that maybe I wouldn't be able to help. But thankfully, there's been just enough webbing there for me to make some sort of difference. As I've learnt in the past, these girls have incredible powers when it comes to rehabilitating these birds. So in the future, I can't rule out the fact that one day Flipper might be able to kick off those shoes and go back to the wild.
But thank you again.
No worries at all.
Thank you again.
You know what? It's always a surprise,
Yes.
but always a pleasant one.
Yes, and going to be plenty more.
That's not my right.
We hope.
So do I.
You stand here and sweat for a minute.
Yeah.
I'm going to bring someone in.
Yeah.
I'll be back in a minute.
At the Australian Reptile Park, rookie snake handler Zach is about to step up his training.
Over the last couple of months, I've been building up my confidence, but something about the look in Tim's eyes getting me a bit nervous coming up here today. Oh, what is that?
We've gone from a Chihuahua to a Great Dane. The tiger snake was the Chihuahua. Your mission for today, to step it up, is to milk this.
Oh, no.
I brought in Australia's largest venomous snake. Zach's reaction is predictable. He's shocked. Whoa, he's fired up, mate.
Yeah.
Okay. Can you move that pin, buddy? All right. Now, we got a kingy. The thing I want you to remember is, it's just bigger. That's all. More powerful, stronger. But mate, you go through your same process, okay?
Yeah.
Now know that he's gonna kick back and whip like this.
Yep.
He might lunge at you. That's okay.
Tim pulls it out and it's like even bigger than him. Not a great feat, but it's still a huge snake. Getting a bit nervous now, like think I've got to handle that in a second, so. Whew.
Now you're a big lad, you know, so for me, he's longer than me. I'm struggling here.
Yeah.
You're a big lad, use that height. Zach's practiced this process many times. First of all with a rubber snake, forever and ever. Then he moved on to tiger snakes. He knows how to do this. It's just a bigger snake. He needs to keep his cool and do what he's learned. Hold him up and be controlled. You right?
Awesome.
You right? Okay. Whoa. Well, he's fired up, mate.
It's a big difference.
Done. I'm going to get that bin out of the way, pal.
Yep.
Okay, so take your time for a sec. Just get used to the feel of him. You look good. You right?
Yep.
That's it. Use your height, pal. Switch hands.
Oh, I don't want to drop the hook. Being the King Brown, it's one of those milestones in your career, so pretty excited but very scared at the same time. I just got to make sure I get a good pin and then get a good grip on him.
Okay. That's it. Use your height. Zach's got the snake out and he looks good. He's a big lad. That height is an advantage. I'm struggling with the heavy snake, whereas he can just hold it up. His handling skills look good. That's it. Okay. You right? That's it. Yeah, I'll jump on that snake for you, pal.
Yep.
There you go. Okay, the head's turned. Wait, now that's what kingies will do.
Yep.
They'll turn it like that, so you want it nice and straight. That's it. Good pressure. Just watch for it to turn. Now, like King Browns do, it's turned its head sideways. That's dangerous. If he grabs it there, the snake can turn around and whack him. Take your time, mate.
Oh, the strength in him is incredible.
Zach said the words that I expected, and he's breathing heavy. Okay, take a break. Feel good?
Yeah.
You look good. Different?
Yeah, the power just in the head alone is incredible.
Yep. You can see that turn, hey? That's what I say. They're more likely to turn, jerk, pull.
Now it's time for the second part of Zach's training, milking the deadly snake.
Okay, now with the kingy too, sometimes they won't want to bite, but you need that chew. So rather than push it in, just gently hold it there and just wait for that pull.
I've got this fella in my hands and all I can see are these huge glands. They're almost twitching with anticipation, like he just wants to unleash this venom. Come on, buddy, come on.
Okay, down, file down more, down. That's it, well done. Well done, buddy. Look at that. Good stuff.
The King Brown bites onto that vial and it's like nothing else. You feel that thud right through your other arm. It's just incredible. Nothing like a tiger snake.
Perfect. Now, there's a catch.
There's always a catch.
Kingies don't let go. So I want you to try and walk him off. Don't pull back on those fangs. If he doesn't, we'll release an enclosure.
Yeah, no, he's not coming off.
Okay. You happy to release him there?
Yep.
Okay, mate, no worries.
I suppose I don't really get a choice, do I?
You don't get a choice. This is all new to Zach, a new process. And the snakes are different, behaviourally, physically. From this middle cabinet, switch around there. The release of a snake after milking is just as dangerous as the restraint. You've got a snake that's only given away 2/3 of its venom. If you get nicked or bitten on the release, you're dead. Okay, all you, vial down, vial down. Hold on. Okay, there you go. 1, 2, 3. Well done, he popped off. Zach's release is good. What you don't want to do is release the snake so it swings to you, can bite you on the leg. You need to go sideways. He does it perfectly. Hold on. You got to get the vial. Take a hook here, mate. Just watch that snake's head. Yep, he's over here. I can see him. I got head. Yep, grab your vial. Beautiful. Well done. Zach's overall performance was gold. I'm really proud of him. I've watched him progress from just handling snakes with a hook to tailing them and now milking. You got that venom?
Yeah, sure do.
Let's have a look. Look at that from a tiger. So you got the world's 4th most venomous snake with a little bit of venom. We got a snake that doesn't even rank in the top 10, but this is classically where you got toxicity versus volume. Which would you rather be bitten by?
Neither.
Good answer. Okay, that's great, mate. You did really well. Let's put these in the freezer.
Yeah, rightio.
This is an odd job, an odd environment, but we save many Australian lives every year. And it's blokes like Zach, willingness to have a go, that makes all the difference.
Hi, Luna. Oh, you already look so much happier. My goodness.
Little Tonkinese kitten Luna has spent the night at Sash, recovering from orthopaedic surgery on her front right leg.
It's looking good. You're already putting weight on it. Hey, it's looking much better already.
It's a remarkable recovery for the 6-month-old after she broke her humerus falling from a bunk bed.
Who would have thought that yesterday your leg was snapped in half and now you are rolling around like this? Huh? Who would have thought?
Luna's wound is looking really good. The leg is a little bit swollen, which is to be expected after she's had a metal plate put in it, but it doesn't seem to be bothering her. In fact, she is so much better than she was yesterday. She's putting weight on the leg and she seems really comfortable. This little girl is ready to go home.
Out in reception, owner Adam and his daughters Molly and Chloe can't wait to see their much-loved kitten.
It's really great to take Luna home. It'll complete our family again because we missed her. Hello.
You won't believe your eyes.
She's as good as new, except balder.
Take her out.
Come here, little girl.
Yeah, she's acting like nothing has happened. When Luna first came in, she wouldn't move. She didn't even want to play with a pen. Most kittens love that. And now she's had her surgery. She's recovering, but I think we've got one last test. There we go. Now that is what a kitten is supposed to do with a pen. Luna, that leg has had surgery, miss. Here's the other one. You wouldn't even know.
But I think we will if she carries on doing that.
Oh, not that one. So it's going to be 6 weeks till things start to heal properly. During that time, she's going to really need to be confined.
The surgeons did an incredible job, considering as well that her arm was hanging yesterday and she's got full mobility today. It's incredible.
No more jumping off beds. Good luck.
Thanks, Lisa.
You've got a hard job ahead of you, I'm warning you. Luna really does have a beautiful nature. She's affectionate and she's interactive, but the thing that strikes me the most is her bravery. She came in here with her leg snapped in half, and now she's out the door as if nothing's happened. How amazing is that?
There are some calls that are just impossible to ignore, and I've had one of those from a girl called Beck who's got a lamb, Oscar, who was attacked by dogs 3 weeks ago.
Chris is in the Adelaide Hills in South Australia. He's had a distressed call from Beck, who opens her heart and her home to animals in need.
Hey, lovely to finally meet you.
Yeah, hope you found it all right.
I did.
I'm
Nice
Beck.
to meet you, Beck.
We're just on a little hobby farm. We're only on 20 acres and it's basically a retirement village for the unwanted.
So where's our boy?
Yeah, down in the laundry, down in his new bedroom.
Of course he is.
Today, Chris is here to see Beck's latest patient, a lamb that's in serious trouble.
Oh, I can hear it.
Yeah, Oscar came into our lives as an orphan. He was only a couple of days old, very sick. He didn't have any of his mother's colostrum or anything. He just became my baby very early on.
Wow, you've been a bit beaten up, haven't you, buddy? Yeah, you agree with that.
3 weeks ago, the little orphan suffered a shocking setback when he was mauled by a dog.
Until this moment, I've only heard about Oscar and the battle he's been through, but when I actually look at him with my own eyes, it all becomes very real, and it's hard not to be shocked by his appearance. It's probably hard, but can you go back to when he was attacked?
I found him curled up next to a water trough.
Yep.
He was just covered in blood. I would jump the fence and had a look and there's just holes everywhere. Called Chris, my husband, and he rushed him off to the vet. First of all, it was just put his face back together. Then we found maggots in his wounds, and then his ear died, so that was removed. At least he's alive. We'll try and keep it that way.
Beck has now turned to Chris because Oscar seems to be deteriorating.
He's just really, I don't know, sad. I know it's like he's giving up a little bit.
Yeah.
You know. Seeing that light going out of his eye, I'm really concerned that he's starting to find it a bit too much. Sorry. I just feel sad for him, that's all. I just feel he's been through so much and he doesn't deserve it, so it's just scary. He's so brave.
Doctor will be here soon. Fix you up. See what's the matter with you, eh?
At the Bondi Referral Hospital SASH, 5-month-old Kaya has been brought in with a very unusual problem.
Kaya's got this red lump below her bottom that I think really needs investigating. And when we first got her, it was just a tiny little nodule, skin colour, and I thought part and parcel of being a pup. But as she's got older, it's got bigger and red.
Anthea and her son Joel are hoping emergency vet Dr. Lisa Chimes will be able to provide some much needed answers.
I am worried, very worried about her. I won't be happy until I know what it is.
Hello. Hi, sweetie.
That's Kaya.
Hi, Kaya. I'm Lisa.
Anthea.
Joel. Nice to meet you. All right, come through. Anthea and Joel have brought Kaya in because they've noticed this fleshy mass protruding from her back end. She also doesn't want to sit down properly, has been licking the area, and generally seems uncomfortable.
So yeah, she's sort of squatting there, but not wanting to put her bottom all the way on the ground. That's definitely abnormal. Hey, sweetheart, do you want to lie down? Lie down on her side. That's the way. Oh, good girl. So I can have a good. Oh, hey, that really is sticking out. I see what you mean. What is going on there?
As an emergency vet, I really don't see things like this very often at all. It's really unusual and it's a real concern for me.
It's swollen, but when I have a feel of the area, it's actually coming from inside her private parts.
Yeah.
This lump has a firmness to it and it extends quite far inside.
What could that be?
Look, this is really unusual. My first impression is that it's the part that should belong on a male.
Really?
Really. However, it could also be some sort of a bit of internal tissue that's popped out, or as unlikely as it is in a young dog, I can't say that it's not some sort of a tumour.
It just makes me want to cry.
Sad, eh?
Yeah. It does, when I think about that. My mind is racing. It's more serious than what I thought.
Before we go any further, let me get the second opinion from Andrew, our surgeon, and then we'll chat about what we can do.
Okay, thank you. I'm starting to panic now. because she's my baby girl and I just don't want anything to be wrong with her.
It's all right. Good girl. Where are Oscar?
In the Adelaide Hills, Chris is taking Oscar outside for a better look at his horrific wounds.
So why don't we start at the front? That seems like the logical.
Do you want me to hold his face up for you?
Yeah, let's do that.
The little lamb was badly mauled by a dog 3 weeks ago, and owner Beck is desperate for help from Chris to find out why his wounds aren't healing.
So you can see that open wound there is trying to heal. It's doing its best, but as it does, that scab is actually tightening the skin and pulling this lip right down, which means he's kind of left with that rather surprised look on his face.
Yeah.
Beck is determined to give the little orphan every chance to survive.
99% of people have said, why haven't you shot him? Straight out. And that it would be kinder on him if I did that. I just can't. He's a member of the family and you don't just do that. He didn't ask for this.
This is going to cause him some problems. Just this lip not really meeting the other lip like it should.
Yeah.
It's going to make eating very hard. It's also going to make drinking nearly impossible because he just can't get that suction and that closure there.
Yeah.
That's issue number one. We'll move along and obviously got some fairly big wounds along here.
Yes.
As I'm working my way around the side of Oscar's face, I can't help but notice that these wounds of his, they're still weeping. It's been 3 weeks since he was attacked. I'd expect they should be healed by now. You know, you go around to this side of the body and all of a sudden you look at this area where the ear used to be and it's still a big open wound. The obvious conclusion to draw from these wounds is the fact they're not healing because there's still bacteria present here and infection is still taking hold of Oscar. For him to heal, he needs to be getting plenty of nutrition in to fuel that whole healing process and to help his immune system and to help that rebuilding that his body needs. So if he's not eating much and if he's not getting that in, then we're starting to build a picture of why he's not healing like he should and why he's not recovering like he should either.
Yep.
Let's have a look here. Now, I don't know if you can see that, but he's got a problem with his jaw somewhere because that's not really sitting the way it should.
Okay.
As I work my way back, I'm really feeling that jawbone to feel for any irregularities. On the left side, I can get right to the back and Oscar doesn't seem to mind it. Along the right side, it's okay at the front, but when I get to the back, it's a different story. Sorry, little man. And you can see it really doubles him over when I touch there. Now, that is the part of his jaw that he relies on to chew grass, because that's where his big molar teeth sit.
Yeah.
And a fractured jaw is really the only thing that would explain why he's unable to eat,
Yep.
why he's unable to chew, and why he just continues to lose weight.
Wow. Can you fix broken jaws?
Now, there might just be a way to allow Oscar to eat where he doesn't have to chew. And there might also be a way that we can stop this jaw from moving and give it a chance to actually start to mend itself.
Okay. I'm scared. What are you going to say? I have no idea.
Just give me a moment and I might be able to round up a few things that could just help him.
That'd be awesome.
So what's up?
Kaya has an abnormal bit of tissue, so to speak,
Where?
in her private area.
Oh, private bits. Oh, no.
At SASH, Lisa has called in specialist surgeon Andrew Marchevsky to try to work out exactly what's wrong with Kaya.
What's that? That shouldn't be there, should it?
Yes.
Oh, darling. It's a bit dried out, isn't it? I know. Gosh, sweetheart, that is sore. Kaya's really uncomfortable with this. It's obviously quite sensitive, and I'm only really lightly touching it, and she's squirming to get away. She's a lovely dog, but she really doesn't want me to touch that. Gosh, it sort of looks like a undeformed male penis. I think really what's going on is she's a hermaphrodite, which means she's got girly bits, but she's got external boy bits. This condition happens every blue moon.
I've never seen one before, so it is not common at all.
Really, the only solution for Kaya is I actually take that tissue out because it's obviously causing her some irritation, and it's only going to get worse, I think, as she gets older. So first thing is we've got to remove this penis because it's just causing her irritation. But the other thing we've got to do is de-sex her. We have to go in and take out either her ovaries or testicles because we don't know what they are yet. And the big problem with their testicles are that they're much higher risk of getting cancer if they stay inside the body. I guess the tricky bit about this is we don't know exactly where her urethra, which is the tube that goes from the bladder outside through which she urinates and pees. So we don't know where that is. We don't know where the opening is. Now, if it's in that area somewhere, we're going to have to, reattach that further up. And that is actually going to be the tricky bit.
Okay.
I think we need to do this sooner rather than later, so...
So you're going to do...
We'll just take her in today and we'll get it done.
All right.
All right?
Okay, I'll leave her in your capable
hands,
Thank
absolutely.
you very much.
No.
Look
Thank
after
you.
her, don't you worry. She will get lots of cuddles.
We're going to make Kaya fully into a girl one way or the other. How I'm going to do that, not quite sure yet. I'll talk to you guys a bit later.
Thank you.
Look after her.
Cheers.
Thank you.
Come on, Kaya.
She'll be all right. Yeah, no, she'll be fine.
Back in South Australia, it's time for Beck to find out what treatment Chris has in store for dog attack victim Oscar.
You're back.
I am back, all right. I come bearing gifts.
Yes.
As keen as I am to jump straight into my elaborate solution I have in mind, I really have to pull back and focus on the number one problem that's affecting Oscar right now, and that is the potential for infection.
First, Chris needs to clean Oscar's wounds with an antiseptic scrub.
I think he quite likes that.
And then administer a stronger course of antibiotics.
I think we need something that's going to be a bit more broad spectrum,
Yep.
which for sheep treats just about everything that could cause him some problems.
Wow, all right.
So now the odds are starting to twist in your favour. So I'm pretty sure I'll come up with a way to isolate his jaw,
Yep.
but still allow him to still eat food.
Right. I really don't know what Chris has got planned here. It's going to be interesting.
I've got
Of course.
a dog muzzle.
Of course.
So the great thing about this is, what does a muzzle do?
Stops the jaw moving from biting. You can't bite.
Yep. So now it's in place, you can see that he can still breathe
Yeah.
through those nostrils. And importantly though, it's going to stop that jaw from moving up and down and side to side. This muzzle ticks all the boxes apart from one really big one. And that's the fact those straps rub across Oscar's biggest wounds. Now, if they keep on doing that, those scabs are never going to heal. So, I've got a plan. And this one is a little bit controversial. You ready? We're going to hold that muzzle into place with Velcro.
Of course.
The Velcro itself needs to be attached to Oscar's skin, and for this, Chris is using super glue.
In Oscar's case, this is a perfect way of attaching this Velcro. And there's no worry about it causing any issues because it only needs to stay in place for a couple of months. Once it's done its job, then it will just fall off naturally. That's now feeling nice and firm, much to Oscar's disapproval. The vet just stuck something to my head.
I probably wasn't expecting like a mainstream solution necessarily because there is none available. So, hey, if it works, go for it. That's awesome. That's a huge change.
As happy as Beck is, I can see that she's still a bit puzzled because all along we've said the important thing for Oscar is the jaw's stable, but he also has to eat. With a muzzle on, surely he can't eat. So we need to find something for him that allows him to eat, but not chew.
Yep.
And I reckon I've got the perfect thing.
Hey, sweet pea. How you doing? Hey, gonna make you a real girl.
At Sash, 5-month-old Staffie Kaya is about to undergo a life-changing operation.
What a good dog.
The little girl was born with what appears to be a partially formed penis.
Basically, she's got a little bit of a boy bit there that's causing her some irritation, so we're going to have to remove that. Okay, Kaya, let's turn you into a girl, huh? We're actually going to de-sex her first. It might seem odd that we've got to de-sex Kaya, but if she's got testicles inside, they're going to be much greater risk of getting cancer, so they've got to come out now. If she's got ovaries, then she'll have a high risk of getting a uterine infection as she gets older, so we've got to get that sorted. Guess what? Oh dear. We've actually found that she has got testicles. The testicles are actually sitting where the ovaries would normally be. So she's actually more genetically a boy than a girl, but her external anatomy is more girl than boy, so it's obvious for us to go that way, so that's what we will do.
The first step in the transformation is to remove the testes.
There we go. One testicle. Right, that's that bit done. Now we're going to actually turn her over and see if we can get rid of this protuberant bit of tissue. All right.
Andrew now has to try to locate the all-important urethra.
Because her anatomy's so distorted, we've got to be really meticulous to make sure we know where everything is before we start cutting anything out. So that little slit, yeah, it is deep, and that's good. We've just identified where that urethral opening is, and it's very deep inside, which is good for her.
Andrew can now begin removing the penis without any disruption to Kaya's urinary function.
So I've actually got to dissect it out rather than just sort of cutting through it and cutting off, because it is really just bone. There we go. Terrific.
Kaya's transformation is complete.
Right, just got the skin to close now. Righto. We're done. Beautiful. Now that looks really nice. They've got rid of that horrible protruding bit of tissue, and you know, she looks now pretty much like she's got normal female anatomy, so that's great.
These are lamb pellets.
In the Adelaide Hills, Chris is now focusing on how to get badly malnourished lamb Oscar eating again.
These are essentially a whole paddock of grass compressed down into small pellets. Pellets soaked in water become a soft gruel. Essentially, Oscar is going to be on the porridge diet. Now, what we can do is get a syringe. The really great thing about these pellets is they're high in protein, they're higher in fat, and also high in calcium. That's exactly what his body needs right now to get its strength back. He'll get used to that.
Yeah.
And he's just using his tongue there. He's not having to make big chewing efforts. So it's actually quite simple on him.
That's excellent.
But there's one other benefit of this.
Yeah.
It's the fact that because this is so small, once he swallows that, he doesn't actually have to bring it back up to break it down anymore. This can go straight through to the last of his stomach.
Of course.
It doesn't have to ruminate, it doesn't have to be crushed up, brought back up his throat, chewed more, and then swallowed again.
Fantastic. I'm definitely relieved. I was starting to feel really quite uncertain, but now it's just, there is a solution. You know, it'll take a little bit of time, but it's just total relief. Total relief.
I think things are looking good for the first time in a long time.
I think so too.
Yeah.
I definitely think so too. Hopefully this is, you know, his path to recovery. This is his way to get better.
Okay, but I'm going to check back in with you and we'll see how he goes. But there's a lot to be positive about.
Thank you.
Oh, hi, Lisa.
Hello, how's she going?
Well, she wants to go home. She says, I'm fixed.
So I take it all went well?
Yeah, no, it went really nice. She's all girl now.
Oh.
Which we can't say she was before.
Hey?
It's been 24 hours since little hermaphrodite dog Kaya's life-changing surgery.
Oh, it looks very good.
Yes.
Just like a girl.
Yep. A little bit of a nip and tuck and she's all there.
Needed.
Hey? The surgery we did on Kaya is not one we have to do every day because it's a rare condition. But in Kaya's situation, we really needed to do it because she was really uncomfortable and it was only going to get worse. So now she's happy and Anthea's got the girl that she's always wanted.
I am so excited to see Kaya again. I'm glad everything went really well, but I just can't wait to get my hands on her and give her lots of kisses and cuddles.
Kaya cannot be happier to run down the corridor and jump into her mum's arms. Looks good.
Oh, she does. She does.
And Anthea cannot get that smile off her face either.
She's able to go to the toilet normally now, and she's able to sit, and she's not really even interested in licking that area, even though she's had surgery there. She's just happy. She's not as irritated, and now she's going to be able to lead a normal life.
Oh, fantastic, fantastic. I'm so happy. I'm over the moon. I can relax now. Thank you.
No problem.
Appreciate it.
Bye, Kaya.
Say bye.
Bye, sweetheart.
She wants to
Bye,
go.
little girl. Kaya's only 5 months old and she's been through a lot of surgery for such a young dog. But now she's got her whole life ahead of her. Bye-bye. Bye.
Kaya.
And Anthea cannot be happier.
Come on. Come on.
2 weeks later, Chris is making a return visit to the Adelaide Hills to see a very special patient.
It's been a few weeks since I first treated Oscar the lamb for the injuries he picked up after being viciously attacked by a pack of dogs. Now, from all reports, he has been gaining some strength, but Beck, his owner, is still concerned about something, and that's why I'm heading there now. So where is he?
He's just in here, he's in a little cubby house. He's locked away from predators in here.
I can hear it. Hello, Oscar.
I think Chris is going to be really surprised when he sees Oscar again.
Hello, buddy. Been wondering how you're going.
He's got his condition back, he's got that sparkle in his eye, he's that sassy little boy again.
Wow. He's put on some weight.
He has.
Yeah, we could feel the bones underneath him before. He's obviously been shorn since, but
yes.
Just across this back line here, he's actually carrying some fat, which he never had before. The biggest test as to how well Oscar's progressed has to be from how his jaw feels. Let's have a little look.
Okay.
Undo your Velcro there. Get the muzzle off. Okay, so obviously he had that fracture just at the base of his mandible here.
Yes.
And I remember when I touched there, he really buckled over and almost fell down the spot.
He did.
So we don't see that same reaction now, which is great.
Fantastic.
It's still too soon for the bone to be healed properly.
Okay.
So what it says is that we're on the right track. There are some really positive signs here, and it's clear that Oscar has progressed, but at the same time, it has not been a complete recovery. All right. He looks great, but you're still concerned about something, right?
Yeah, his lip is worse as he's healing. It seems to be pulling down more. As soon as the muzzle's off, it's just gaping.
Yeah, so he's kind of got that consistently grim look on his face, as in...
Yes, you can see all his bottom teeth. You can see right into his mouth, and it's gaping more and more every day. He can't drink properly. He can't eat properly. It's affecting his quality of life.
Whilst those scabs there shrinking down is a good thing here, unfortunately, under here when it's happened, with those wounds there and across his chin there, when that's happened and the skin's shrunken and tightened up, it's pulled that lip down.
Yeah.
An exposed lip like this is really going to be a magnet for flies that want to come in and lay their eggs there. Once they do that, maggots will develop, and then Oscar's lip could become fly-blown. From there, it could be life-threatening. Just going to have a play around his mouth and just see what we need to do.
I really hope Chris can do something with Oscar today. I don't have very high hopes because it's pretty bad. Mind you though, Chris has pulled something out the hat last time, so nothing would surprise me.
We want to get those lips actually coming back together.
Yeah.
But there's a bit of tension there when I do push up. It feels like it's a real effort to get that skin to actually meet up with the top lip.
Yeah.
So we kind of need to do two things. We need to relieve that tension from that scar, but also we need to stretch this lip back up and put it into its proper place.
Okay.
Quite seriously, Beck, what he needs is a facelift.
Wow.
And if it's all right with you, I would like to do it now.
Let's go.
Yeah?
Yeah, definitely.
So Oscar, one more little procedure. You got it in you? Yeah? All right, buddy.
I'm on my way to work, and I've just had an interesting call from some friends of mine. They've seen a critter in their lounge room, and my guess is it's probably nothing, but I'm going to go and check it out.
Australian Reptile Park General Manager Tim Faulkner is answering a call for help from family friends who live close to the park.
Hello.
Hello.
What's going on?
We have got the ugliest spider. Well, so Slim said. He screamed like a girl.
You should have seen it. It was massive.
How big?
It's just started behind the TV just then.
With a scary intruder on the loose, Kirsty and Salim are worried about the safety of their young children, Tilly and Maeve.
The fear of having spiders in the house would be how venomous they are, how deadly they are. They could bite us and potentially kill us.
So how big are we talking?
Mate, it was pretty big. I reckon about that big.
Tarantula?
Well, it seemed that big when I was scurrying across there.
Righto. Salim says it was decent size, which means it's probably not going to climb up a wall. It's going to be a ground spider. But you know, there are lots of big black spiders, and it could be any one of 10 species.
The most dangerous culprit would be a redback or a deadly funnel web.
The plan of attack is to just have a look peripherally because I've got two little kids running around. Now, I could be looking in one spot. I don't want a spider popping out in another spot and getting someone on the toe. So you haven't seen it for 20 minutes, eh?
About 20 minutes.
Just hang back from there a little bit, girls, in case there's something behind there.
I am not impressed that we have a spider loose in our house. The thing that scares me is that the kids might get bitten, so this is a little bit worrying.
Come on down.
You found it?
Nope. Not yet. Wait. Nothing under the sofa. Little bit of dust, little bit of mess. That's normal, but no spider. Let's just have a look in here. Yep, just watch your fingers there, mate. Yeah. Little bit.
Pretty
just
heavy.
Slider.
Till hop up on the couch. I'm getting on the couch too, in case he runs out.
In behind the TV cabinet, I can see a lot of cords, that's standard. But then one leg pops out. Kirst, you are not going to believe what it is.
Holy hell.
Tilly, just watch out there, darling.
So brave.
So brave. Guess he's been through a lot.
Yes.
In the Adelaide Hills, Chris is sedating Oscar the lamb in preparation for his much-needed facelift.
Okay, what we do need is kind of a makeshift surgical table.
I was wondering about that.
Yeah. Would you have something like a picnic rug that we can just put over this straw here?
I do.
Yeah?
Yeah.
That'd be great. And maybe a bowl of water as well.
I can do that.
All right.
All right.
Thank you.
It's hoped the procedure will stop the risk of infection in Oscar's gaping lip and allow him to eat and drink normally.
This is going to be a facelift with serious medical benefits for Oscar, but it's not going to be straightforward. We've got to fight against all that scar tissue that's pulling that lip downwards.
This good enough?
Perfect. Once I get in there, I've got to loosen that up and push that lip upwards.
You're a mama's boy.
There we go. All right. Yeah, he's certainly relaxing. His heart rate's slowing down. And
okay.
As you can see, he's very keen to lie down there. Considering everything that Oscar's been through already, the last thing I want him to experience today is pain. That's why I'm giving him a sedation, plus some local anaesthetic injected around our surgical site. How you doing, buddy? So I'm just going to clean up the area where we're going to make these incisions, and then we'll get started. Even though I'm operating in a paddock, the same rules as a normal surgical theatre apply. I have to make sure this surgery is as sterile as possible. Okay, perfect. Righto, we'll make our first cut.
Okay.
So we've got our V-shaped cut there. Now, I'm just going to go underneath that incision.
Okay.
And work my way underneath the skin just to try to free up some extra loose skin there.
Okay.
Problem goes, there's so much blood supply there from the healing that
okay.
that's why it's going to bleed a lot more than it probably normally would.
Yep.
As I push those scissors underneath the scar, it's clear this is where our problem lies. It's almost impossible for me to drive those scissors through the scar tissue and free up this space. It's really quite tough in there.
I can feel it.
Yeah, so that's what we're really battling against.
Holy hell.
You are not going to believe what it is. Tilly, just watch out there, darling.
Stay away, darling.
Watch out there.
At a family home in suburban Sydney, Tim has just made a shocking discovery.
I did not expect to find a funnel web spider inside my friend's house, the world's deadliest spider. Just hang back there because he might come under.
This is the spider that ran across right there where the kids are.
Yep.
TVs, that's unbelievable.
People have died in 75 minutes after being bitten by a funnel web. Now for little kids, they're smaller and that can happen quicker. That's really scary.
The pressure is now on Tim to catch the deadly intruder.
Hey, watch in case... Whoa, hold on, he's on the floor, guys. Take that, mate. Oh, he's moving. Where is he? Funnel webs are not only venomous, they're very aggressive. Big fangs. When they're cornered or they feel threatened, they just rear up, show you their fangs, and ready to bite. Oh, no, hold on. Here he is.
Got him?
I do, but he's back. He's on the wall.
He's not easy to catch, is he?
Nope.
Come on, little buddy. In you go.
Got him.
Did you really?
He's all right, Maeve. Unbelievable.
Look at that.
Look,
You are
Maeve,
kidding.
he's all right now that he's in here. So, Kirst, I wish I could have told you it's not to worry about, but that is a funnel web spider and a male, the deadliest spider on Earth.
Oh my goodness.
This is every parent's worst nightmare, but Tim has even more bad news.
Do you know why I think he's in your house? Because he's looking for a girl.
Yeah, right.
So you're likely to have...
Potentially, there could be
Big
another
girl.
You're likely to have some girls around. The boys, you know, this weather warms up a little bit. They go out in search of females, and that's what you end up with.
My heart's beating. The last thing I want to find is another funnel web lurking around our household.
It's pushing through that scar tissue there now.
Yeah.
In the Adelaide Hills, Chris has begun surgery on Oscar to try to lift up the little lamb's gaping bottom lip.
It's really quite tough in there.
I can feel it.
Yeah, so that's what we're really battling against.
But the tough scar tissue from Oscar's original injuries is making it difficult for Chris to loosen up the skin.
I'm watching Chris pushing really hard, and I can feel that scar tissue that he's trying to push through.
We're making progress.
Okay.
Okay, good stuff.
Finally, Chris breaks through and can begin to reposition the lip.
The area around Oscar's chin is now loose, but ultimately gravity could just pull his lip straight back down. Thankfully, I've got something in mind that's going to keep that lip right where I need it. What we need to do is attach this suture here to his teeth.
Okay. Wow.
The teeth are shaped in kind of a V-shaped wedge. That means if I can get the suture around the base of them, they'll actually lock in place. So we're now going to push this through his lip and start to see what our plan is here.
Oh, wow. Chris's idea, now that I can actually see it, when he was telling me, well, I'm not so sure, but now that I can actually see it with my eyes, I think it's genius.
Just because there's going to be a bit of tension going through one very narrow area here,
Yep.
I'll make one little adaptation. So this is a drip set.
Yeah.
I'm just going to take a little section of this tubing here. By feeding the tubing through the suture line, what I can do is actually position it across his lip and make sure it doesn't cut into the skin. Okay, so now, push this up. I'm going to slide these over the base of his teeth there.
Gosh, that looks excellent.
Yeah, it's a big improvement.
Huge.
I'm really happy with how this is now sitting. But before we wake him up, Oscar still has that open wound on his neck. So I've got one more task to achieve.
That's a good boy, Oscar. You're almost done here, matey.
Want to look under the dishwasher?
At a family home in suburban Sydney, Tim is still on the hunt for more deadly funnel web spiders.
Well, I'm pretty happy inside. So, how about if we have a look outside and see where your little mate might have come from?
Yep, all right. My worry now is that I found a male inside. They've also got a backyard, and there could be spiders out there. It's the right time of year, it's warming up. I think I should investigate a little bit more.
Okay. Come on, follow me.
And just see if I can identify any areas the girls shouldn't go, or potential spots there are more spiders.
So I'm just going to have a look around and just see. The yard's perfect for them. It's wet, it's cold, damp, spider heaven. Look, you found a hole.
Eagle Eyes Maeve, she's onto something straight away.
Well, that's a good home. It goes a long way.
It's a perfect spider home, but nobody's here today, so I keep moving.
Let's have a look down here.
So I'm digging around, using my spoon, and there's a big plant pot that's on its side. I flip it over, and lo and behold, there is our second funnel web.
That's incredible.
Oh my goodness. Till, look at this. Oh.
And we'll just be a little more careful with this one because it doesn't have the clips.
Is it a female?
This is a big female.
Oh no.
So Tim's found another spider in our garden where my girls play, and I'm not happy about this.
You know why they're so dangerous? Because of those really big fangs.
Now I'm going to take the spiders inside because I don't want the girls growing up scared of spiders. I want them to develop a healthy respect.
Are they quite aggressive? They're super aggressive. So this is why funnel webs are so famous. They're not afraid to bite. They rear up like this, and you know what he's doing right now? Showing you his fangs.
Looks like something's coming out of it.
That's venom.
There you
so
go.
So really aggressive. There's
like
no
a little droplet on.
That's right. There's no chance if this spider bites you that you're not going to receive venom. He's already got it on there, ready to rock and roll.
The fangs are huge, and even to see a bit of venom coming out of them, very, very scary stuff.
She's on the move now, so I'm going to put her back in here. There we go. Lid on. We caught a spider.
Wow. Thanks, Timmy.
I've got 2 spiders here today, but only the male can be used for the anti-venom program because he's 5 times more venomous than the female. That's the one we need.
Thank you very much.
No, good on you, mate.
Thank you.
Till?
Thanks, Tim.
I think we called the right person.
Give me a shake. No, you did. Hit me. See you, Kirst.
See ya.
And I'm going to go.
So all we need to do now is just stitch this space back together.
Yep.
Oh my good.
Excellent, all right.
Over in the Adelaide Hills, Chris is in the last stages of surgery to fix Oscar the lamb's gaping lip.
You're almost done here, matey.
6 weeks ago, Oscar was left for dead after a vicious dog attack. It's been a long road to recovery, but Chris hopes this procedure will finally be the last for the poor lamb.
Right, well, that's the last stitch done.
Wow. Looking handsome?
You're looking pretty good, Oscar, I gotta say.
Oscar looks like his old self. Even though he has one ear, he looks almost as good as new.
There's no reason that he now can't live a normal life.
Finally.
Oscar, almost ready to stand up? Yeah? You ready? You up?
Okay.
Drink already. We'll test it out. Where are you going?
After all the setbacks in Oscar's life, it finally feels like he's back on track. And you get the clear impression he does not want to waste a moment more. Why wait to get on with the rest of your life, huh?
This is the Oscar that I know. He's back. It's amazing, it's fantastic. Thank you.